A rash is any area of irritated or swollen skin on your body. Rashes are often itchy and painful and can appear differently on different skin tones. While they are often described as red, on darker skin tones, they may be purple, gray, or white. Rashes have a variety of causes, from bites to chickenpox to serious conditions like drug allergies. Seek medical attention if home remedies do not help or if you also have symptoms such as fever or dizziness. Pictures of different rashes. There are many different causes of rashes. Here's a list of 22 potential causes with pictures. Flea bites. Flea bites of the lower leg causing red bumps and scabbing. Angela Hampton Picture Library/Alamy stock photo. Usually located in clusters on the lower legs and feet. Itchy, small red bumps on lighter skin tones and more plum-like in color on darker skin tones. Symptoms begin immediately after being bitten. Read the full article on flea bites. Fifth disease. Fifth disease is a viral illness caused by parvovirus, which can cause a slapped cheek rash. Cardle and Young, N. via Wikipedia. Symptoms include headache, fatigue, low fever, sore throat, runny nose, diarrhea, and nausea. Children are more likely than adults to experience a rash. Round, bright red rash on the cheeks, but it may be less noticeable on darker skin tones. Usually after the face rash, a lacy patterned rash may appear on the arms, legs, and upper body and might be more visible after a hot shower or bath. Read the full article on fifth disease. Rosacea. Weinkel, A. P., Dr. V., and Emmer, J., 2015. Update on the management of rosacea. Clinical, Cosmetic and Investigational Dermatology, 8, 159-177, https://doi.org/10.2147/ccid.s58940. Chronic, long-term, skin disease that goes through cycles of fading and relapse. Relapses may be triggered by spicy foods, alcoholic beverages, sunlight, stress, and the intestinal bacteria Helicobacter pylori. The 4 subtypes of rosacea encompass a wide variety of symptoms. Common symptoms include facial flushing, raised red bumps, facial redness, skin dryness, and skin sensitivity. On darker skin tones, brown or yellowish-brown bumps may appear, and the rash can have a dusky coloration. Read the full article on rosacea. Impetigo. This image also depicts impetigo on dark skin. Photography courtesy of Group de Ogre/Wikimedia. Most common in children 2 to 5 years old. Trusted source, but can happen at any age. Often located in the area around the mouth, chin, and nose. Irritating rash and fluid-filled blisters that pop easily and form a honey-colored crust. Can also appear brown, purple, or gray on darker skin tones. Read the full article on impetigo. Ringworm. Ringworm on the face of a child. Psip SA/Alamy stock photo. Itchy, circular scaly patches with raised borders. On lighter skin tones, the patches can appear pink or red. On darker skin tones, the patches can appear gray or brown. Skin in the middle of the ring appears clearer, and the edges of the ring may spread outward. Read the full article on ringworm. Contact dermatitis. Contact dermatitis of the arm. Vo/Shutterstock. Appears hours to days after contact with an allergen. Has visible borders and typically appears where your skin touched the irritating substance. On lighter skin tones, it can appear red. On darker skin tones, it may be less noticeable. May have blisters that weep, ooze, or become crusty. Typically itchy, scaly, or raw. May resemble a burn. Often found on hands and forearms. Skin is itchy, scaly, or raw. May have blisters that weep, ooze, or become crusty. On lighter skin tones, it can appear red. On darker skin tones, it can cause darker brown, purple, or gray patches. Read the full article on allergic eczema. Hand, foot, and mouth disease. Hand, foot, and mouth disease Midgley DJ at n.wikipedia, cc BY SA 3.0, via Wikimedia Commons. Usually affects children under age 5. Painful, red blisters in the mouth and on the tongue and gums. Flat or raised red spots located on the palms of the hands and soles of the feet. On darker skin tones, it can be skin-colored or grayish-brown. Spots may also appear on the buttocks or genital area. Read the full article on hand, foot, and mouth disease. Diaper rash. Located on areas that have contact with a diaper. Skin looks red, wet, and slightly lighter or darker than typical skin color. May be warm to the touch. Read the full article on diaper rash. Eczema. Benislav/Shutterstock. Dry, rough, flaky, inflamed, and irritated skin. Affected areas may be red and itchy. Hair loss may occur in the area with the rash. On darker skin tones, it can appear as darker brown or gray patches. Read the full article on eczema. Psoriasis. Psoriasis is an inflammatory skin condition that causes dry, scaly plaques on the skin. It is immune system mediated, and genetics likely also play a role. Viteg 2808/Shutterstock. Scaly, silvery, sharply defined skin patches. On darker skin tones, it may look darker than the surrounding skin or it might appear purple. Commonly located on the scalp, elbows, knees, and lower back. May be itchy or asymptomatic. Read the full article on psoriasis. Chickenpox. Child with chickenpox group de Ogre, CC by SA 4.0, via Wikimedia Commons. Clusters of itchy, red, fluid-filled blisters in various stages of healing all over the body. On darker skin tones, it can be red, the same as the natural skin tone, or a little darker. Scabs can appear gray. Rash is accompanied by fever, body aches, sore throat, and loss of appetite. Remains contagious until all blisters have crusted over. Read the full article on chickenpox. Systemic lupus erythematosus, SLE. Butterfly rash. SLE. Systemic lupus erythematosus. An autoimmune disease that displays a wide variety of symptoms and affects many body systems and organs. A wide array of skin and mucous membrane symptoms that range from rashes to ulcers. Classic butterfly-shaped face rash that crosses from cheek to cheek over the nose. Can appear bright red on lighter skin tones. On darker skin tones, it may appear red, brown, or darker than the original skin color. Rashes may appear or get worse with sun exposure. Read the full article on systemic lupus erythematosus, SLE. Painful rash that may burn, tingle, or itch, even if there are no blisters present. Clusters of fluid-filled blisters that break easily and weep fluid. Rash emerges in a band-like pattern that appears most commonly on the torso, but may occur on other parts of the body, including the face. May be accompanied by low fever, chills, headache, or fatigue. Read the full article on shingles. Cellulitis. Cellulitis of the lower legs. Tisfurthen/Shutterstock. This condition is considered a medical emergency. Urgent care is required. Caused by bacteria or fungi entering through a crack or cut in the skin. Tends to be red or pink. It may appear less obvious on darker skin tones and can also look brown, gray, or purple. Painful, swollen skin with or without oozing that spreads quickly. Hot and tender to the touch. Might be a sign of serious infection requiring medical attention. Read the full article on cellulitis. Drug allergy. This condition is considered a medical emergency. Urgent care is required. Mild to severe itchy, red rash may occur days to weeks after taking a drug. Severe drug allergies can be life-threatening, and symptoms include rash, blisters, hives, racing heart, swelling, itching, and difficulty breathing. Other symptoms include fever, stomach upset, and tiny purple or red dots on the skin. Read the full article on drug allergies. Scabies. Scabies is an itchy skin infestation with mites. Public domain, via Wikimedia Commons. Symptoms may take 2 to 5 weeks. Trusted source to appear. Extremely itchy rash with small bumps that may be scaly, raised, white, or flesh-toned lines. Read the full article on scabies. Measles. Measles on the torso of a child. Fichet Chayabin/Shutterstock. Symptoms include fever, sore throat, red watery eyes, loss of appetite, cough, and runny nose. Depending on skin tone, the rash may be red, skin-colored, or darker than the natural skin color. The rash spreads from the face down the body 3 to 5 days after first symptoms appear. Tiny white spots with bluish-white centers on a red background can appear inside the mouth. Read the full article on measles. Tick bite. Iter Diego/Getty Images. Painless and causes only minor signs and symptoms, such as a change in skin color, swelling, or a sore on the skin. Rash, burning sensation, or blisters. Difficulty breathing, which requires immediate medical attention. The tick often remains attached to the skin for a long time. Bites rarely appear in groups. May look like a target, circular, expanding. 70 to 80% trusted source of people with Lyme disease will have this rash. Read the full article on tick bites. Seborrheic eczema. Z99/Shutterstock. Yellow or white scaly patches that flake off. Affected areas may be red though they may appear faint on darker skin tones, itchy, greasy, yellowish or white patches. Hair loss may occur in the rash area. Occurs at the same time as or right after a strep throat infection. Rash is made up of tiny bumps that make it feel like sandpaper. Bright red tongue. People with lighter skin tones can have a bright red rash all over the body, but not on the palms of your hands and soles of your feet. On people with darker skin tones, it may be more difficult to see the rash, but their skin will have a sandpaper-like texture. Read the full article on scarlet fever. Kawasaki disease. This condition is considered a medical emergency. Urgent care is required. Usually affects children under age 5. Red cracked lips, swollen tongue, strawberry tongue, high fever, swollen red palms and soles of the feet, swollen lymph nodes, bloodshot eyes. Can be harder to recognize on darker skin tones. May cause severe heart problems. Read the full article on Kawasaki disease. What causes rashes? Contact dermatitis. Contact dermatitis is one of the most common causes of rashes. This type of rash occurs when the skin comes into direct contact with a foreign substance that causes an adverse reaction, leading to a rash. The resulting rash may be itchy, red, or inflamed. Possible causes of contact dermatitis include beauty products, soaps, laundry detergent, dyes in clothing, chemicals in rubber, elastic, or latex, poisonous plants such as poison oak, poison ivy, or poison sumac. Medications. Taking medications may also cause rashes. They can form as a result of an allergic reaction to the medication, a side effect of the medication, photosensitivity from the medication. Other causes. Other possible causes of rashes include the following. A rash can sometimes develop in the area of a bug bite, such as a flea bite. Tick bites are of particular concern because they can transmit disease. Atopic dermatitis, the most common form of eczema, is a rash that may be more common in people with asthma or allergies. The rash is often reddish, though it can be skin-colored or darker on people with darker skin tones. It can be itchy with a scaly texture. Psoriasis is a common skin condition that can cause a scaly, itchy, red, or purplish rash to form along the scalp, elbows, and joints. Seborrheic eczema is a type of eczema that most often affects the scalp and causes redness, scaly patches, and dandruff. It can also occur on the ears, brows, or nose. When babies have it, it's known as cradle cap. Systemic lupus erythematosus is an autoimmune disease that can trigger a rash on the cheeks and nose. This rash is known as a butterfly or mailer rash. Rosacea is a chronic skin condition of unknown cause. There are several types of rosacea, but all are characterized by redness and rash on the face. Ringworm is a fungal infection that causes a distinctive ring-shaped rash. The same fungus that causes ringworm on the body and the scalp also causes jock itch and athlete's foot. Diaper rash is a common skin irritation in infants and toddlers. It can be associated with prolonged exposure to a wet diaper. Scabies is an infestation by tiny mites that live on and burrow into your skin. It causes a bumpy, itchy rash. Cellulitis is a bacterial infection of the skin. It usually appears as a red, swollen area that is painful and tender to the touch. If left untreated, the infection causing the cellulitis can spread and become life-threatening. Causes of rashes in children. Children are particularly prone to rashes that develop as a result of illnesses. Chickenpox is caused by a virus, and the rash is characterized by small itchy bumps and blisters that form all over the body. Measles is a viral respiratory infection that causes a widespread rash consisting of itchy, red bumps. Scarlet fever is an infection due to group A Streptococcus bacteria that produces a toxin, causing a bright red or skin tone colored, sandpaper-like rash. Hand, foot, and mouth disease is a viral infection that can cause red lesions on the mouth and a rash on the hands and feet. Fifth disease is a viral infection that causes a red, flat rash on the torso, arms, and legs. Kawasaki disease is a rare but serious illness that triggers a rash and fever in the early stages and can lead to heart complications. Impetigo is a contagious bacterial infection that causes an itchy, crusty rash and yellow, fluid-filled sores on the affected area, such as the face, neck, or hands. You can treat most contact rashes, but it depends on the cause. Follow these guidelines to help ease discomfort and speed up the healing process. Use mild, gentle cleansers instead of scented bar soaps. Use warm water instead of hot water for washing your skin and hair. Pat the rash dry instead of rubbing it. Let the rash breathe. If it's possible, avoid covering it with clothing. Stop using new cosmetics or lotions that may have triggered the rash. Apply unscented moisturizing lotion to areas affected by eczema. Avoid scratching the rash because doing so can make it worse and could lead to infection. Apply an over-the-counter, OTC, hydrocortisone cream to the affected area if the rash is very itchy and causing discomfort. Calamine lotion can also help relieve rashes from chickenpox, poison ivy, or poison oak. Take an oatmeal bath. This can soothe the itchiness associated with rashes from eczema or psoriasis. Here's how to make an oatmeal bath. Wash your hair and scalp regularly with dandruff shampoo if you have dandruff along with a rash. Medicated dandruff shampoo is commonly available at drugstores, but your doctor can prescribe stronger types if you need them. Over-the-counter, OTC, medications. Talk with a healthcare professional, who may recommend OTC medication like ibuprofen or acetaminophen to treat mild pain associated with the rash. Avoid taking these medications for an extended period because they can have side effects. Ask a healthcare professional how long it's safe for you to take them. You may not be able to take them if you have liver or kidney disease or a history of stomach ulcers. When to see a healthcare professional about rashes. Call a healthcare professional if the rash doesn't go away with home remedies. You should also contact them if you're experiencing other symptoms in addition to your rash and you suspect you have an illness. If you don't already have a physician, you can use the Healthline Find Care tool to find a professional near you. Go to the hospital immediately if you experience a rash along with any of the following symptoms. Increasing pain or discoloration in the rash area. Tightness or itchiness in the throat. Difficulty breathing. Swelling of the face or limbs. Fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. Confusion. Dizziness. Severe head or neck pain. Repeated vomiting or diarrhea. Contact a healthcare professional if you have a rash as well as other systemic symptoms, including joint pain, a sore throat, red streaks or tender areas near the rash, a recent tick bite or animal bite. What to expect during your appointment. Your healthcare professional will perform a physical exam and inspect your rash. Expect to answer questions about your rash, medical history, diet, recent use of products or medications, hygiene. Your healthcare professional may also take your temperature, order tests such as an allergy test or complete blood count, perform a skin biopsy, which involves taking a small sample of skin tissue for analysis, refer you to a specialist, such as a dermatologist, for further evaluation. Your healthcare professional may also prescribe medication or medicated lotion to relieve your rash. Most people can treat their rashes effectively with medical treatments and home care. What you can do now. Follow these tips if you have a rash. Use home remedies to soothe mild contact rashes. Identify potential triggers for the rash and avoid them as much as possible. Call a healthcare professional if the rash doesn't go away with home treatments. You should also contact them if you're experiencing other symptoms in addition to your rash and you suspect you have an illness. Carefully follow any treatments your doctor prescribes. Speak with a healthcare professional if your rash persists or worsens despite treatment. Summary. Rashes are areas of irritated or swollen skin. These areas may become itchy, painful, or dry out. Skin discoloration is a common rash symptom, which can present differently on different skin tones. Rashes may appear red or pink on lighter skin tones, while on darker skin tones they may be purple, gray, or white. What is chickenpox? Chickenpox, also called varicella, is characterized by itchy red blisters that appear all over the body. A virus causes this condition. It often affects children, and was so common it was considered a childhood rite of passage. It's very rare to have the chickenpox infection more than once. And since the chickenpox vaccine was introduced in the mid-1990s, cases have declined. What are the symptoms of chickenpox? An itchy rash is the most common symptom of chickenpox. The infection will have to be in your body for around 7 to 21 days before the rash and other symptoms develop. You start to be contagious to those around you up to 48 hours before the skin rash starts to occur. The non-rash symptoms may last a few days and include fever, headache, loss of appetite. 1 or 2 days after you experience these symptoms, the classic rash will begin to develop. The rash goes through 3 phases before you recover. These include You develop red or pink bumps all over your body. The bumps become blisters filled with fluid that leaks. The bumps become crusty, scab over, and begin to heal. The bumps on your body will not all be in the same phase at the same time. New bumps will continuously appear throughout your infection. The rash may be very itchy, especially before it scabs over with a crust. You are still contagious until all the blisters on your body have scabbed over. The crusty scabbed areas eventually fall off. It takes 7 to 14 days to disappear completely. What causes chickenpox? Varicella zoster virus, VZV, causes the chickenpox infection. Most cases occur through contact with an infected person. The virus is contagious to those around you for 1 to 2 days before your blisters appear. VZV remains contagious until all blisters have crusted over. The virus can spread through saliva, coughing, sneezing, contact with fluid from the blisters. Who is at risk of developing the chickenpox? Exposure to the virus through previous active infection or vaccination reduces risk. Immunity from the virus can be passed on from a mother to her newborn. Immunity lasts about 3 months from birth. Anyone who has not been exposed may contract the virus. Risk increases under any of these conditions. You have had recent contact with an infected person. You are under 12 years of age. You are an adult living with children. You have spent time in a school or child care facility. Your immune system is compromised due to illness or medications. How is chickenpox diagnosed? You should always call your doctor anytime you develop an unexplained rash, especially if it's accompanied by cold symptoms or fever. One of several viruses or infections could be affecting you. Tell your doctor right away if you are pregnant and have been exposed to chickenpox. Your doctor may be able to diagnose chickenpox based on a physical exam of blisters on you or your child's body. Or, lab tests can confirm the cause of the blisters. What are possible complications of chickenpox? Call your doctor right away if the rash spreads to your eyes. The rash is very red, tender, and warm, signs of a secondary bacterial infection. The rash is accompanied by dizziness or shortness of breath. When complications occur, they most often affect infants, older adults, people with weak immune systems, pregnant women. These groups may also contract VZV pneumonia or bacterial infections of the skin, joints, or bones. Women exposed during pregnancy may bear children with birth defects, including poor growth, small head size, eye problems, intellectual disabilities. How is chickenpox treated? Most people diagnosed with chickenpox will be advised to manage their symptoms while they wait for the virus to pass through their system. Parents will be told to keep children out of school and day care to prevent spread of the virus. Infected adults will also need to stay home. Your doctor may prescribe antihistamine medications or topical ointments, or you may purchase these over the counter to help relieve itching. You can also soothe itching skin by taking lukewarm baths, applying unscented lotion, wearing lightweight, soft clothing. Your doctor may prescribe antiviral drugs if you experience complications from the virus or are at risk for adverse effects. People at high risk are usually the young, older adults, or those who have underlying medical issues. These antiviral drugs do not cure chickenpox. They make the symptoms less severe by slowing down viral activity. This will allow your body's immune system to heal faster. What is the long-term outlook? The body can resolve most cases of chickenpox on its own. People usually return to normal activities within 1 to 2 weeks of diagnosis. Once chickenpox heals, most people become immune to the virus. It won't be reactivated because VZV typically stays dormant in the body of a healthy person. In rare cases, it may re-emerge to cause another episode of chickenpox. It is more common for shingles, a separate disorder also triggered by VZV, to occur later during adulthood. If a person's immune system is temporarily weakened, VZV may reactivate in the form of shingles. This usually occurs due to advanced age or having a debilitating illness. How can chickenpox be prevented? The chickenpox vaccine prevents chickenpox in 98% of people who receive the 2 recommended doses. Your child should get the shot when they are between 12 and 15 months of age. Children get a booster between 4 and 6 years of age. Older children and adults who haven't been vaccinated or exposed may receive catch-up doses of the vaccine. As chickenpox tends to be more severe in older adults, people who haven't been vaccinated may opt to get the shots later. People unable to receive the vaccine can try to avoid the virus by limiting contact with infected people. But this can be difficult. Chickenpox can't be identified by its blisters until it has already been spreadable to others for days. Chickenpox in adults. Symptoms. Pictures. Recovery. Risk factors. Complications. Treatment. Chickenpox and shingles. Outlook. Although chickenpox is often thought of as a childhood disease, adults are still susceptible and symptoms tend to be more severe. However, if you've had chickenpox as a child, you're unlikely to get chickenpox as an adult. Also known as varicella, chickenpox is caused by the varicella-zoster virus, VZV. It is most often recognized by a rash of itchy red blisters that appear on the face, neck, body, arms, and legs. People who've had chickenpox typically have an immunity to the disease. So, if you had chickenpox as a child, it's unlikely you will get chickenpox as an adult. Chickenpox symptoms in adults. Chickenpox symptoms in adults typically resemble those in children, but they can become more severe. The disease progresses through symptoms that start 1 to 3 weeks after exposure to the virus, including flu-like symptoms such as fever, fatigue, loss of appetite, body aches, and headache. These symptoms typically start a day or two before a rash appears. Red spots appear on the face and chest, eventually spreading over the entire body. The red spots develop into itchy, fluid-filled blisters. Blisters weep, become sores, form crusts, and heal. As some of the blisters form crusts, it's not unusual for more red spots to appear, for a total of 250 to 500 blisters. Pictures. View gallery. 3. Chickenpox recovery time. For adults, new chickenpox spots often stop appearing by the 7th day. After 10 to 14 days, the blisters scab over. Once the blisters are scabbed over, you are no longer contagious. Are you at risk? As an adult, you are at risk of getting chickenpox if you didn't have chickenpox as a child or haven't had the chickenpox vaccine. Other risk factors include living with unvaccinated children under the age of 12, working in a school or child care space, spending more than 15 minutes in a room with an infected person, touching the rash of a person infected with chickenpox or shingles, touching something recently used by an infected person such as clothing or bedding. You are at a higher level risk of experiencing complications from the disease if you are a pregnant woman who hasn't had chickenpox, a person who is on medication that suppresses your immune system, such as chemotherapy, a person whose immune system is impaired by another disease, such as HIV, a person who is on steroid medications for another condition, such as rheumatoid arthritis, a person with an immune system weakened by a previous organ or bone marrow transplant. Complications. Chickenpox is normally a mild, but uncomfortable, disease. However, this condition can lead to serious complications, hospitalization, and even death. Some complications include bacterial infections of the skin, soft tissues, and/or bones, sepsis or a bacterial infection of the bloodstream, bleeding problems, dehydration, encephalitis or inflammation of the brain, pneumonia, Reye syndrome, particularly if a child takes aspirin while infected with chickenpox, toxic shock syndrome, chickenpox and pregnancy. If a pregnant woman develops chickenpox, she and her unborn child are at risk for serious complications including pneumonia, low birth weight, birth defects such as abnormal limbs and brain development, life-threatening infection. Chickenpox treatment for adults. If you have chickenpox, your doctor will treat the symptoms and let the disease run its course. Recommendations typically include calamine lotion and colloidal oatmeal baths to relieve itching, a pain reliever to reduce fever. In certain circumstances, your doctor may also prescribe drugs such as acyclovir or valacyclovir to combat the virus and prevent complications. Chickenpox vaccine. There is a 2-dose chickenpox vaccine, Varivax, that's about 94% effective at preventing the disease for your lifetime. Adults who haven't had chickenpox will get 2 doses about 1 month apart. Your doctor may advise against receiving this vaccine if you have a moderate or severe illness, you plan to become pregnant in the next 30 days, you have an allergy to any ingredient in the vaccine, such as gelatin or neomycin, or if you had a serious allergic reaction to a previous dose of the chickenpox vaccine. You have undergone chemotherapy or radiation for cancer. You have been taking steroid drugs. You have a disease that compromises your immune system, such as HIV. You recently received a blood transfusion. Are there risks with the chickenpox vaccine? Your doctor will recommend the chickenpox vaccine if they believe the risks associated with it are much lower than the risks associated with the disease itself. While some people may develop a low-grade fever or mild rash after being injected with the chickenpox vaccine, the most common side effects are redness, swelling, or soreness at the vaccination site. Other very rare severe side effects include anaphylaxis, ataxia or loss of balance, cellulitis, encephalitis, non-febrile seizures or seizures without fever, pneumonia, chickenpox and shingles. If you've had chickenpox, then you still have the varicella-zoster virus in your nerve cells. It never goes away and it can lie dormant for years. Even though you are now most likely immune to reinfection from the chickenpox virus, you're at risk of another disease, shingles. Shingles is a painful viral infection that is characterized by a blistering skin rash that forms in a band in a specific location of the body. It most often appears on the left or right side of your torso, sometimes around one eye or on one side of the face or neck. Shingles is most likely to appear in older adults and people with weakened immune systems. 2 shingles vaccines, Zostavax and Shingrix, are available and many doctors recommend them for their patients who have had chickenpox and are age 50 and older. Outlook. Have you had chickenpox? Have you received the chickenpox vaccine? Answer those questions and follow these recommendations. If you've had chickenpox or the chickenpox vaccine, you should be immune and have little to worry about regarding catching chickenpox. If you haven't had chickenpox, you should talk to your doctor about getting the vaccine. If you've had chickenpox, you should talk to your doctor about the shingles vaccine, especially if you are over 50 years old. If you think you have chickenpox, contact your doctor for a full diagnosis and treatment recommendations. What is chickenpox? Chickenpox is a highly contagious viral infection caused by the varicella-zoster virus. Along with flu-like symptoms like headache and fatigue, its most recognizable symptom is an inflamed, itchy, red rash that turns into fluid-filled blisters. The rash and blisters typically start on the face, chest, and back. They ultimately spread and cover the entire body. In some cases, the rash may spread to the mucous membranes in your mouth. Chickenpox sores in your mouth, however, don't look like the chickenpox blisters on your body. These sores look like raised bumps that last about a day. They then transform into ulcers that are shallow and yellow or gray in color. They also don't crust over. Chickenpox usually lasts less than 2 weeks. The majority of people who have had chickenpox are immune to having chickenpox again. There's also a vaccine that's considered to be about 94% effective, according to vaccines.gov. Treatment for chickenpox inside the mouth. The general treatment for chickenpox is letting the disease run its course. But you can relieve symptoms by using the following. Antihistamines such as diphenhydramine, Benadryl, can ease itchiness. Non-aspirin pain relievers such as acetaminophen, Tylenol, can relieve fever. Over-the-counter topical lotions or creams, such as calamine lotion, can soothe itching. A prescription antibiotic ointment can help treat infected blisters. Warning: don't give children under 18 aspirin, especially if they have a viral infection like chickenpox. The combination of viral infections and aspirin has been associated with Reye's syndrome, a rare yet potentially deadly condition. Treatment if it spreads to the mouth. If chickenpox blisters spread to your mouth and tongue, it will add to your discomfort. But it isn't usually considered serious. If you have chickenpox in your mouth, your doctor will most likely recommend one or a combination of these regimens for treatment. Bland diet. Avoiding hot beverages and spicy, salty, and acidic foods can limit the irritation and discomfort in your mouth. Local anesthetics. Applying a doctor-recommended local anesthetic on the interior surface of your mouth and on your tongue can block the pain caused by oral sores. Cold food. Consuming cold drinks and foods can help numb any discomfort. Hydration. Drinking plenty of fluids, especially water, fights off dehydration. Dehydration can worsen your symptoms. Oral hygiene. Keeping your mouth and tongue clean with a mild toothpaste and flossing regularly will help prevent a secondary bacterial infection. Gargling with plain water will also help by washing away bacteria and debris. Treatment if the condition is serious. If your doctor feels you have a more severe case of chickenpox, they may prescribe an antiviral medication such as acyclovir, Zovirax, or valacyclovir, Valtrex. Is there a cure for chickenpox? There's no cure for chickenpox. But once the disease has run its course, most people are immune to chickenpox for the rest of their lives. However, the varicella-zoster virus will live on in nerve tissue. According to the Centers for Disease Control and Prevention, CDC, about 1 in 3 trusted source Americans will develop another rash driven by the same chickenpox virus, called shingles. Shingles is a painful and itchy rash that typically lasts about a month. What's the outlook? With the highly effective chickenpox vaccine released in 1995 and aggressive vaccination program, chances are you're in the clear. It's becoming increasingly less likely for you to be exposed to or contract the disease. If you do suspect that you may have been exposed to chickenpox and are worried that you've contracted the virus, see your doctor. They can make a quick and easy diagnosis and recommend a course of treatment. Measles, or rubeola, is a viral infection that starts in the respiratory system. It still remains a significant cause of death worldwide, despite the availability of a safe, effective vaccine. There were about 110,000 global deaths related to measles in 2017, most of them in children under the age of 5, according to the World Health Organization, WHO, trusted source. Measles cases have also been increasing in the United States in recent years. Learn more about the symptoms of measles, how it spreads, and how it can be prevented. Measles symptoms. Symptoms of measles generally first appear within 10 to 12 days of exposure to the virus. They include cough, fever, runny nose, red eyes, sore throat, white spots inside the mouth. A widespread skin rash is a classic sign of measles. This rash can last up to 7 days and generally appears within 14 days of exposure to the virus. It commonly develops on the head and slowly spreads to other parts of the body. Measles causes. Measles is caused by infection with a virus from the paramyxovirus family. Viruses are tiny parasitic microbes. Once you've been infected, the virus invades host cells and uses cellular components to complete its life cycle. The measles virus infects the respiratory tract first. However, it eventually spreads to other parts of the body through the bloodstream. Measles is only known to occur in humans and not in other animals. There are 24 trusted source known genetic types of measles, although only 6 are currently circulating. Is measles airborne? Measles can be spread through the air from respiratory droplets and small aerosol particles. An infected person can release the virus into the air when they cough or sneeze. These respiratory particles can also settle on objects and surfaces. You can become infected if you come into contact with a contaminated object, such as a door handle, and then touch your face, nose, or mouth. The measles virus can live outside of the body for longer than you may think. In fact, it can remain infectious in the air or on surfaces for up to 2 hours. Trusted source. Is measles contagious? Measles is highly contagious. This means that the infection can spread very easily from person to person. A susceptible person that's exposed to the measles virus has a 90% chance of becoming infected. Additionally, an infected person can go on to spread the virus to anywhere between 9 and 18 susceptible individuals. A person that has measles can spread the virus to others before they even know that they have it. An infected person is contagious for 4 days before the characteristic rash appears. After the rash appears, they're still contagious for another 4 days. The main risk factor for catching measles is being unvaccinated. Additionally, some groups are at a higher risk of developing complications from measles infection, including young children, people with a weakened immune system, and pregnant women. Diagnosing measles. If you suspect that you have measles or have been exposed to someone with measles, contact your doctor immediately. They can evaluate you and direct you where to be seen to determine if you have the infection. Doctors can confirm measles by examining your skin rash and checking for symptoms that are characteristic of the disease, such as white spots in the mouth, fever, cough, and sore throat. If they suspect you may have measles based on your history and observation, your doctor will order a blood test to check for the measles virus. Treatment for measles. There's no specific treatment for measles. Unlike bacterial infections, viral infections aren't sensitive to antibiotics. The virus and symptoms typically disappear in about 2 or 3 weeks. There are some interventions available for people who may have been exposed to the virus. These can help prevent an infection or lessen its severity. They include a measles vaccine, given within 72 hours of exposure. A dose of immune proteins called immunoglobulin, taken within 6 days of exposure. Your doctor may recommend the following to help you recover: acetaminophen, Tylenol, or ibuprofen, Advil, to reduce fever. Rest to help boost your immune system. Plenty of fluids. A humidifier to ease a cough and sore throat. Vitamin A supplements. Pictures. View gallery. 6. Measles in adults. Although it's often associated with childhood illness, adults can get measles too. People who aren't vaccinated are at a higher risk of catching the disease. It's generally accepted that adults born during or before 1957 are naturally immune to measles. This is because the vaccine was first licensed in 1963. Before then, most people had been naturally exposed to the infection by their adolescent years and became immune as a result. According to the Centers for Disease Control and Prevention, CDC, trusted source, serious complications are not only more common in young children, but also in adults over the age of 20. These complications can include things like pneumonia, encephalitis, and blindness. If you're an adult who hasn't been vaccinated or isn't sure of their vaccination status, you should see your doctor to receive the vaccination. At least one dose of the vaccine is recommended for unvaccinated adults. Measles in babies. The measles vaccine isn't given to children until they're at least 12 months old. Before receiving their first dose of the vaccine is the time they're most vulnerable to being infected with the measles virus. Babies receive some protection from measles through passive immunity, which is provided from mother to child through the placenta and during breastfeeding. However, research trusted source has shown that this immunity can be lost in just over 2.5 months after birth or the time breastfeeding is discontinued. Children under 5 years of age are more likely to have complications due to measles. These can include things like pneumonia, encephalitis, and ear infections that can result in hearing loss. Incubation period for measles. The incubation period of an infectious disease is the time that passes between exposure and when symptoms develop. The incubation period for measles is between 10 and 14 days. After the initial incubation period, you may begin to experience nonspecific symptoms, such as fever, cough, and runny nose. The rash will begin to develop several days later. It's important to remember that you can still spread the infection to others for 4 days prior to developing the rash. If you think you've been exposed to measles and haven't been vaccinated, you should contact your doctor as soon as possible. Measles types. In addition to a classic measles infection, there are also several other types of measles infections that you can get. Atypical measles occurs in people who received a killed measles vaccine between 1963 and 1967. When exposed to measles, these individuals come down with an illness that has symptoms such as high fever, rash, and sometimes pneumonia. Modified measles occurs in people who've been given post-exposure immunoglobulin and in infants who still have some passive immunity. Modified measles is typically milder than a regular case of measles. Hemorrhagic measles is rarely reported in the United States. It causes symptoms like high fever, seizures, and bleeding into the skin and mucous membranes. Measles versus rubella. You may have heard rubella referred to as German measles. But measles and rubella are actually caused by 2 different viruses. Rubella isn't as contagious as measles. However, it can cause serious complications if a woman develops the infection while pregnant. Even though different viruses cause measles and rubella, they're also similar in several ways. Both viruses can be spread through the air from coughing and sneezing, cause fever and a distinctive rash, occur only in humans. Both measles and rubella are included in the measles mumps rubella, MMR, and measles mumps rubella varicella, MMRV, vaccines. Measles prevention. There are few ways to prevent becoming ill with measles. Vaccination. Getting vaccinated is the best way to prevent measles. 2 doses of the measles vaccine are 97% trusted source effective at preventing measles infection. There are 2 vaccines available, the MMR vaccine and the MMRV vaccine. The MMR vaccine is a 3-in-1 vaccination that can protect you from measles, mumps, and rubella. The MMRV vaccine protects against the same infections as the MMR vaccine and also includes protection against chickenpox. Children can receive their first vaccination at 12 months, or sooner if traveling internationally, and their second dose between the ages of 4 and 6. Adults who have never received an immunization can request the vaccine from their doctor. Some groups shouldn't receive a vaccination against measles. These groups include people who've had a previous life-threatening reaction to the measles vaccine or its components, pregnant women, immunocompromised individuals, which can include people with HIV or AIDS, people undergoing cancer treatment, or people on medications that suppress the immune system. Side effects to vaccination are typically mild and disappear in a few days. They can include things like fever and mild rash. In rare cases, the vaccine has been linked to low platelet count or seizures. Most children and adults who receive a measles vaccine don't experience side effects. Some believe that the measles vaccine can cause autism in children. As a result, an intense amount of study has been devoted to this topic over many years. This research has found that there is no trusted source between vaccines and autism. Vaccination isn't just important for protecting you and your family. It's also important for protecting people who can't be vaccinated. When more people are vaccinated against a disease, it's less likely to circulate within the population. This is called herd immunity. To achieve herd immunity against measles, approximately 96% trusted source of the population must be vaccinated. Other prevention methods. Not everyone can receive the measles vaccination. But there are other ways that you can help to prevent the spread of measles. If you're susceptible to infection, practice good hand hygiene. Wash your hands before eating, after using the bathroom, and before touching your face, mouth, or nose. Don't share personal items with people who may be ill. This can include things like eating utensils, drinking glasses, and toothbrushes. Avoid coming into contact with people who are sick. If you're sick with measles, stay home from work or school and other public places until you aren't contagious. This is 4 days after you first develop the measles rash. Avoid contact with people who may be vulnerable to infection, such as infants too young to be vaccinated and immunocompromised people. Cover your nose and mouth if you need to cough or sneeze. Dispose of all used tissues promptly. If you don't have a tissue available, sneeze into the crook of your elbow, not into your hand. Be sure to wash your hands frequently and to disinfect any surfaces or objects that you touch frequently. Measles during pregnancy. Pregnant women who don't have immunity to measles should take care to avoid exposure during their pregnancy. Coming down with measles during your pregnancy can have significant negative health effects on both the mother and fetus. Pregnant women are at an increased risk for complications from measles such as pneumonia. Additionally, having measles while pregnant can lead to the following pregnancy complications: miscarriage, preterm labor, low birth weight, stillbirth. Measles can also be transmitted from mother to child if the mother has measles close to her delivery date. This is called congenital measles. Babies with congenital measles have a rash after birth or develop one shortly afterward. They're at an increased risk of complications, which can be life-threatening. If you're pregnant, don't have immunity to measles, and believe that you've been exposed, you should contact your doctor immediately. Receiving an injection of immunoglobulin may help to prevent an infection. Measles prognosis. Measles has a low death rate in healthy children and adults, and most people who contract the measles virus recover fully. The risk of complications is higher in the following groups: children under 5 years old, adults over 20 years old, pregnant women, people with a weakened immune system, individuals who are malnourished, people with a vitamin A deficiency. Approximately 30% trusted source of people with measles experience one or more complications. Measles can lead to life-threatening complications, such as pneumonia and inflammation of the brain, encephalitis. Other complications associated with measles may include ear infection, bronchitis, croup, severe diarrhea, blindness, pregnancy complications, such as miscarriage or preterm labor, subacute sclerosing panencephalitis, SSPE, a rare degenerative condition of the nervous system that develops years after infection. It is highly unlikely that you get measles more than once. After you have had the virus, your body has developed immunity against the infection. However, measles and its potential complications are preventable through vaccination. Vaccination not only protects you and your family, but also prevents the measles virus from circulating in your community and affecting those who can't be vaccinated. What is rubeola, measles? Rubeola, measles, is an infection caused by a virus that grows in the cells lining the throat and lungs. It's a very contagious disease that spreads through the air whenever someone who is infected coughs or sneezes. People who catch the measles develop symptoms such as a fever, cough, and runny nose. A telltale rash is the hallmark of the disease. If measles isn't treated, it can lead to complications such as ear infection, pneumonia, and encephalitis, inflammation of the brain. The first signs. Within 7 to 14 days after getting infected with the measles, your first symptoms will appear. The earliest symptoms feel like a cold or the flu, with a fever, cough, runny nose, and sore throat. Often the eyes get red and runny. 3 to 5 days later, a red or reddish-brown rash forms and spreads down the body from head to foot. Koplik spots. 2 to 3 days after you first notice measles symptoms, you may start to see tiny spots inside the mouth, all over the cheeks. These spots are usually red with blue-white centers. They're called Koplik spots, named for pediatrician Henry Koplik, who first described the early symptoms of measles in 1896. Koplik spots should fade as the other measles symptoms disappear. The measles rash. The measles rash is red or reddish-brown in color. It starts on the face and works its way down the body over a few days, from the neck to the trunk, arms, and legs, until it finally reaches the feet. Eventually, it will cover the entire body with blotches of colored bumps. The rash lasts for 5 or 6 days in total. Immunocompromised people might not have the rash. Time to heal. There isn't any real treatment for measles. Sometimes getting the measles, mumps, and rubella, MMR, vaccine within the first 3 days after being exposed to the virus can prevent the disease. The best advice for people who are already sick is to rest and give the body time to recover. Stay comfortable by drinking plenty of fluids and taking acetaminophen, Tylenol, for fever. Don't give aspirin to children, because of the risk for a rare but serious condition called Reye's syndrome. Measles complications. About 30% of people who get the measles develop complications such as pneumonia, ear infections, diarrhea, and encephalitis, according to the CDC trusted source. Pneumonia and encephalitis are two severe complications that could require hospitalization. Pneumonia. Pneumonia is an infection of the lungs that causes fever, chest pain, trouble breathing, cough that produces mucus. People whose immune system has been weakened by another disease can get an even more dangerous form of pneumonia, encephalitis. About 1 out of every 1,000 children with measles will develop swelling of the brain called encephalitis, according to the CDC trusted source. Sometimes encephalitis starts right after the measles. In other cases, it takes months to emerge. Encephalitis can be very serious, leading to convulsions, deafness, and mental retardation in children. It's also dangerous for pregnant women, causing them to give birth too early or to have a baby born underweight. Other infections with rashes. Rubeola, measles, is often confused with roseola and rubella, German measles, but these 3 conditions are different. Measles produces a splotchy reddish rash that spreads from head to foot. Roseola is a condition that affects infants and toddlers. It causes a rash to form on the trunk, which spreads to the upper arms and neck and fades within days. Rubella is a viral disease with symptoms including a rash and fever that last 2 to 3 days. Getting over the measles. Symptoms of the measles often disappear in the same order in which they first emerged. After a few days, the rash should start to fade. It may leave behind a brownish color on the skin, as well as some peeling. The fever and other measles symptoms will recede and you or your child should begin to feel better. Measles is one of the world's most contagious viruses, and yes, it can be deadly. Before the measles vaccine was introduced in 1963, worldwide epidemics occurred every few years. These epidemics resulted in about 2.6 million trusted source deaths annually. The widespread use of vaccinations has significantly decreased this number. In 2018, it was estimated that only 142,000 trusted source deaths from measles occurred worldwide. Unvaccinated young children are at the highest risk of measles complications, including deaths, according to the World Health Organization, WHO, trusted source. Unvaccinated pregnant women and those with compromised immune systems are also more vulnerable regarding risk of complications and possible death. Today, the measles virus is making a resurgence in multiple countries. The uptick in measles cases may be due to the circulation of misinformation about the measles and related vaccines, which has led to an anti-vaccination movement. In this article, we'll discuss how severe infection with the measles virus can be. We'll also explore some of the myths surrounding the measles vaccine, to help you separate fact from fiction. Read on. The severity of measles. Measles is a virus, and its initial symptoms can resemble a flu. People infected with measles may experience a high fever, cough, and runny nose. Within a few days, you may see the telltale measles rash that consists of small, red bumps that are widespread, starting from the hairline on the face and eventually working its way towards the feet. Complications from measles. A measles infection can lead to a variety of complications, some of which are immediate or severe, while others may be lifelong. These include acute complications. These include diarrhea and ear infections. Hospitalization is also common. Severe complications. These include premature births in infected pregnant people, encephalitis, pneumonia, and hearing loss. Long-term complications. These can lead to intellectual or developmental disabilities in babies and young children. Neurological complications such as rare subacute sclerosing panencephalitis, SSPE, are also possible measles-related developments. It's estimated that up to 3 in every 1,000 children trusted source with measles will die from respiratory and neurologic complications. How important is the vaccination? The problem with measles is that, not only is it highly contagious, but you may be an unknowing carrier of the virus for several days. In fact, you may contract the virus but not have any symptoms until 10 to 12 days trusted source after initial contact has occurred. Like other viruses, measles can be spread from contact, but it's also extremely airborne, lasting for a couple hours in the air. This is why the measles vaccine is so important in bringing down the numbers of infections, as well as subsequent complications and deaths. Immunizations come in the form of the measles, mumps, and rubella, MMR, vaccine, as well as the MMRV vaccine in children at 12 months up through the age of 12 years, which offers additional protection against varicella, chickenpox. Overall, statistics have shown that the measles vaccine has directly impacted the rate of measles infections and subsequent deaths. In fact, there was a 73% decrease trusted source in measles deaths worldwide, noted between 2000 and 2018. Outbreaks of the infection are more prominent in developing countries where the vaccine isn't as widely available, as well as areas where people actively refuse the vaccine. Is the vaccine safe? The measles vaccine is considered safe trusted source. 2 recommended doses are 97% effective, 1 dose is 93% effective. However, as with any other vaccine, there's a very small risk of causing an allergic reaction in some people. It's estimated that less than 1 in every 1 million doses of measles vaccine given may cause a severe allergic reaction to the MMR vaccine. Ask your doctor about your individual risk, particularly if you have a history of allergic reactions to shots. Who should not get the vaccine? While widely recommended for children and healthy adults, there's also certain people who should not get the measles vaccine. These include children under 12 months of age. The exception is children at 6 months of age who live in a measles-prone outbreak area. Women who are or likely may be pregnant. People with serious active illnesses or infections, such as tuberculosis. Those who have undergone a recent blood product transfusion. People with immune system deficiency issues related to cancer treatments, HIV/AIDS, and other medical considerations. People with a severe gelatin allergy may increase your risk of allergic reaction. Myths about measles. Due to concerns about vaccines and other health issues, myths about measles are spreading around the internet, posing risks for the spread of the actual virus in real life. Below are some of the most common claims made about the measles virus and the MMR/MMRV vaccine. Claim 1. The measles isn't a big concern in developed nations, such as the United States. False. While it's true that measles is more prominent in developing countries due to lack of access to vaccines, measles infection rates have increased in the United States over the last 20 years. In 2019, the United States saw the greatest number of measles cases trusted source since the virus was eliminated in 2000. Check with your doctor and local health officials for measles advisories in your area, and make sure your vaccine schedules are up to date. Claim 2. The death rate doesn't warrant the use of measles vaccines. False. While it's possible to survive a measles infection, there are too many deadly complications associated with it. Not getting the measles vaccine puts yourself at risk for the virus. It also makes you a possible carrier, putting sensitive groups, such as young children, at risk, too. Claim 3. The vaccine doesn't offer 100% protection. True. But the statistics are close. The measles vaccine has a protection rate trusted source of 93% with 1 dose, while 2 doses have a 97% protection rate. The key here is that the more prevalent vaccines are in a populace, the less likely the virus will infect people and spread. Claim 4. Natural methods can help prevent the measles instead of relying on vaccines. False. Good hygiene should be exercised by everyone, regardless of their vaccination status. However, this isn't enough to prevent a highly contagious airborne virus like the measles. Furthermore, no vitamins, herbs, or essential oils will help to kill this virus. Plus, there's no way to treat the actual virus, only its complications. The only scientifically proven mode of protection is the MMR vaccine. Claim 5, the MMR vaccine causes autism. False. This is a previous claim that has long since been debunked. Part of the reason why this myth is so prevalent is that signs of autism are often more strongly realized and diagnosed in affected children around 12 months of age, which also happens to be the time children receive their first MMR vaccine. Key takeaways. Measles is a highly contagious and potentially deadly virus. The most effective way to prevent this viral infection is by getting vaccinated. However, not everyone can get the vaccine. This is why it's also important to make sure that people who can get the MMR vaccine get their initial shot and booster. Since measles is also spread through the air, you can be at a higher risk of getting infected if you live in or visit an area where the infection is prominent. You can help protect yourself and your family by staying up to date on any local measles outbreak advisories from schools and local health officials. Talk to a doctor about your individual concerns regarding the measles virus and vaccine. What is German measles? German measles, also known as rubella, is a viral infection that causes a red rash on the body. Aside from the rash, people with German measles usually have a fever and swollen lymph nodes. The infection can spread from person to person through contact with droplets from an infected person's sneeze or cough. This means that you can get German measles if you touch your mouth, nose, or eyes after touching something that has droplets from an infected person on it. You may also get German measles by sharing food or drinks with someone who's infected. German measles is rare in the United States. With the introduction of the rubella vaccine in the late 1960s, the incidence of German measles significantly declined. However, the condition is still common in many other parts of the world. It mainly affects children, more commonly those between 5 and 9 years old, but it can also occur in adults. German measles is typically a mild infection that goes away within 1 week, even without treatment. However, it can be a serious condition in pregnant women, as it may cause congenital rubella syndrome in the fetus. Congenital rubella syndrome can disrupt the development of the baby and cause serious birth defects, such as heart abnormalities, deafness, and brain damage. It's important to get treatment right away if you're pregnant and suspect you have German measles. What are the symptoms of German measles? The symptoms of German measles are often so mild that they're difficult to notice. When symptoms do occur, they usually develop within 2 to 3 weeks after the initial exposure to the virus. They often last about 3 to 7 days and may include pink or red rash that begins on the face and then spreads downward to the rest of the body, mild fever, usually under 102 degrees Fahrenheit, swollen and tender lymph nodes, runny or stuffy nose, headache, muscle pain, inflamed or red eyes. Although these symptoms may not seem serious, you should contact your doctor if you suspect you have German measles. This is especially important if you're pregnant or believe you may be pregnant. In rare cases, German measles can lead to ear infections and brain swelling. Call your doctor immediately if you notice any of the following symptoms during or after a German measles infection: prolonged headache, earache, stiff neck. What causes German measles? German measles is caused by the rubella virus. This is a highly contagious virus that can spread through close contact or through the air. It may pass from person to person through contact with tiny drops of fluid from the nose and throat when sneezing and coughing. This means that you can get the virus by inhaling the droplets of an infected person or touching an object contaminated with the droplets. German measles can also be transmitted from a pregnant woman to her developing baby through the bloodstream. People who have German measles are most contagious from the week before the rash appears until about 2 weeks after the rash goes away. They can spread the virus before they even know that they have it. Who is at risk for German measles? German measles is extremely rare in the United States, thanks to vaccines that typically provide lifelong immunity to the rubella virus. Most cases of German measles occur in people who live in countries that don't offer routine immunization against rubella. The rubella vaccine is usually given to children when they're between 12 and 15 months old, and then again when they're between ages 4 and 6. This means that infants and young toddlers who haven't yet received all vaccines have a greater risk of getting German measles. To avoid complications during pregnancy, many women who become pregnant are given a blood test to confirm immunity to rubella. It's important to contact your doctor immediately if you've never received the vaccine and think you might have been exposed to rubella. How does German measles affect pregnant women? When a woman contracts German measles during pregnancy, the virus can be passed on to her developing baby through her bloodstream. This is called congenital rubella syndrome. Congenital rubella syndrome is a serious health concern, as it can cause miscarriages and stillbirths. It can also cause birth defects in babies who are carried to term, including delayed growth, intellectual disabilities, heart defects, deafness, poorly functioning organs. Women of childbearing age should have their immunity to rubella tested before becoming pregnant. If a vaccine is needed, it's important to get it at least 28 days before trying to conceive. How is German measles diagnosed? Since German measles appears similar to other viruses that cause rashes, your doctor will confirm your diagnosis with a blood test. This can check for the presence of different types of rubella antibodies in your blood. Antibodies are proteins that recognize and destroy harmful substances, such as viruses and bacteria. The test results can indicate whether you currently have the virus or are immune to it. How is German measles treated? Most cases of German measles are treated at home. Your doctor may tell you to rest in bed and to take acetaminophen, Tylenol, which can help relieve discomfort from fever and aches. They may also recommend that you stay home from work or school to prevent spreading the virus to others. Pregnant women may be treated with antibodies called hyperimmune globulin that can fight off the virus. This can help reduce your symptoms. However, there's still a chance that your baby will develop congenital rubella syndrome. Babies who are born with congenital rubella will require treatment from a team of specialists. Talk to your doctor if you're concerned about passing German measles on to your baby. How can I prevent German measles? For most people, vaccination is a safe and effective way to prevent German measles. The rubella vaccine is typically combined with vaccines for the measles and mumps as well as varicella, the virus that causes chicken pox. These vaccines are usually given to children who are between 12 and 15 months old. A booster shot will be needed again when children are between ages 4 and 6. Since the vaccines contain small doses of the virus, mild fevers and rashes may occur. If you don't know whether you've been vaccinated for German measles, it's important to have your immunity tested, especially if you are a woman of childbearing age and aren't pregnant. Attend an educational facility. Work in a medical facility or school. Plan to travel to a country that doesn't offer immunization against rubella. While the rubella vaccine usually isn't harmful, the virus in the shot could cause adverse reactions in some people. You shouldn't be vaccinated if you have a weak immune system due to another illness, are pregnant, or plan to become pregnant within the next month. Mom posts photo of infant battling measles to encourage vaccination. Jilly Moss shared images of her hospitalized infant daughter on Facebook. Jilly Moss and her daughter Alba before the infant contracted measles. Photo courtesy Jilly Moss. Multiple outbreaks of the measles virus in the United States and across the globe have resulted in a worldwide spike of cases. In the United States alone, there have been 704 cases of the measles trusted source, breaking a 25-year record. The United Kingdom has also seen an increase in measles cases in recent years, with at least 32 diagnosed just in the Manchester area this year. These outbreaks are particularly concerning for infants, who are especially vulnerable to the highly contagious virus and too young to be immunized. The virus is easily transmitted and can remain in the air for 2 hours after a person infected with measles has left the area. Jilly Moss, a mother in the United Kingdom, recently experienced the measles outbreak firsthand. Moss' infant daughter, Alba, contracted the measles before she was old enough to get vaccinated. Moss shared a series of photos on Facebook detailing her baby's painful, life-threatening battle with the measles. We just want to share our story and show people how poorly babies and vulnerable people can become with the virus. Alba is recovering well from it, but other babies and children have not been so lucky, Moss told Healthline. Alba was too young to be vaccinated and spent days in the hospital with a high fever and eyes swollen shut. Photo courtesy Jilly Moss. The infant was admitted to Chelsea in Westminster Hospital in London for 8 days, where doctors worked around the clock to treat Alba and bring her back to good health. While the hospital wouldn't comment on a patient's condition, they didn't dispute Moss' account. It has been absolutely horrific watching our daughter fight this with her eyes swollen shut for 4 days. She has been in the dark, scared with a high fever that lasted for over 2 weeks, Moss wrote on Facebook. Moss added that the infection could have been prevented if more children older than Alba had been vaccinated. She said she's sharing her story to encourage more parents to get their children vaccinated. Here's why infants are so much more susceptible. There are a couple reasons why the measles is especially dangerous to infants, according to health experts. First off, the measles mumps rubella, MMR, vaccine doesn't work as well in infants under 1 This is because antibodies are transferred from the mother to the baby, and though this can provide some protection, it makes the shot less effective, according to the Centers for Disease Control and Prevention trusted source, CDC. Both the United States and the United Kingdom recommend getting the first dose around 1 year of age and the second between 4 to 6 years of age. Because the measles virus is so contagious, a person with active measles will infect 9 out of every 10 non-immune individuals they encounter. This leaves newborns at a high risk of contracting the disease if cases are present in the community, said Dr. Bernhard L. Wiederman, a pediatric infectious diseases physician at Children's National Health System and professor of pediatrics with the George Washington University School of Medicine and Health Sciences. Secondly, because infants' immune systems aren't fully developed, they tend to experience more severe cases of the measles along with more dangerous complications such as pneumonia, encephalitis, an infection of the brain tissue, seizures, and death. Because of this, the measles and any other complications that may occur are much more difficult to manage in younger children. For a doctor, it is scarier to have a 2 or 3-month-old infant in the hospital as compared to a 2 or 3-year-old toddler. The infant has fewer reserves, it is harder for the staff to manage the medications and fluids, and the infection can spread to other parts of the body more easily, said Dr. Jamie Luer, a family physician with Cayuga Family Medicine in Ithaca, New York. Vaccinations help protect those who can't get the shot. The MMR vaccine doesn't just protect you, but it helps protect others who are more susceptible to contracting the measles, such as infants and people who have compromised immune systems. The shot is extremely safe and effective. The first dose of the MMR vaccine protects 93% of recipients, while the second dose protects 97%, according to the CDC. The most important way to protect fragile members of the community from measles is to not get the disease in the first place, and the best way to do that is to get the measles vaccine, Luer explained. In order for an umbrella of immunity to take effect and fully protect a community, nearly 95% of the population must be vaccinated. This high level of vaccination creates herd immunity, which prevents an infectious disease from spreading in a community, since most people will be immune. Closing the vaccination gaps. Due to misinformation, growing skepticism about vaccines, and lack of access, however, vaccination levels have been plummeting year after year. According to the World Health Organization trusted source, vaccine hesitancy is a huge threat, as it reverses the progress we've made in controlling vaccine-preventable diseases, such as the measles. A new study published by UNICEF found that nearly 500,000 children in the United Kingdom hadn't received the MMR vaccine. Additionally, on a list of the top 10 high-income countries, the United States had the highest number of children who didn't have their first dose of the MMR vaccine. These startling vaccination gaps have paved the way for the surges in measles outbreaks taking place across the globe. In order to beat the outbreaks and keep vulnerable populations safe, vaccination coverage must increase so we can create that protective umbrella of immunity. Most of the public has never seen the ravages of the measles. And this is a very good thing, Wiederman said. If we step up immunizations now, none of us need to see a case like this child's again. The bottom line. A mother in the United Kingdom shared a series of photos on Facebook detailing her baby's painful, life-threatening battle with the measles. The infant contracted the measles before she was old enough to get vaccinated. In order to protect vulnerable populations like infants, about 95% of the population needs to be vaccinated. How are diseases transmitted? Direct contact. Indirect contact. Preventing transmission. Takeaway. Infectious diseases are transmitted from person to person by direct or indirect contact. Certain types of viruses, bacteria, parasites, and fungi can all cause infectious diseases. Malaria, measles, and respiratory illnesses are examples of infectious diseases. Simple preventive measures, such as frequent handwashing, can cut down on disease transmission. Direct contact. Infectious diseases are often spread through direct contact. Types of direct contact include the following. 1. Person-to-person contact. Infectious diseases are commonly transmitted through direct person-to-person contact. Transmission occurs when a person with an infectious disease touches or exchanges body fluids with someone else. This can happen before they are aware of the illness. Sexually transmitted diseases, STDs, and gastrointestinal infections can be transmitted this way. Pregnant people can also transmit infectious diseases to their unborn fetuses via the placenta. Some STDs, including gonorrhea, can be passed from gestational parent to baby during childbirth. 2. Droplet spread. The spray of droplets during coughing and sneezing can spread an infectious disease. You can even infect another person through droplets created when you speak. Since droplets fall to the ground within a few feet, this type of transmission requires close proximity. Indirect contact. Infectious diseases can also be spread indirectly through the air and other mechanisms. For example, 1. Airborne transmission. Some infectious agents can travel long distances and remain suspended in the air for an extended period of time. You can catch a disease like measles by entering a room after someone with measles has departed. 2. Contaminated objects. Some organisms can live on objects for a short time. If you touch an object, such as a doorknob, soon after a person with an infectious disease, you might be exposed to infection. Transmission occurs when you touch your mouth, nose, or eyes before thoroughly washing your hands. Germs can also be spread through blood products and medical supplies containing the virus or bacteria. 3. Food and drinking water. Infectious diseases can be transmitted via food and water containing the virus or bacteria. E. coli is often transmitted through improperly handled produce or undercooked meat. Improperly canned foods can create an environment ripe for Clostridium botulinum, which can lead to botulism. 4. Animal-to-person contact. Some infectious diseases can be transmitted from an animal to a person. This can happen when an animal with an infection bites or scratches you, or when you handle animal waste. The Toxoplasma gondii parasite can be found in cat feces. Pregnant people and people with compromised immune systems should take extra care, disposable gloves and good handwashing when changing cat litter, or avoid it altogether. 5. Animal reservoirs. Animal-to-animal disease transmission can sometimes transfer to humans. Zoonosis occurs when diseases are transferred from animals to people. Zoonotic diseases include anthrax, from sheep, rabies, from rodents and other mammals, West Nile virus, from birds, plague, from rodents. 6. Insect bites, vector-borne disease. Some zoonotic infectious agents are transmitted by insects, especially those that suck blood. These include mosquitoes, fleas, and ticks. The insects become infected when they feed on infected hosts, such as birds, animals, and humans. The disease is then transmitted when the insect bites a new host. Malaria, West Nile virus, and Lyme disease are all spread this way. 7. Environmental reservoirs. Soil, water, and vegetation containing infectious organisms can also be transferred to people. Hookworm, for example, is transmitted through infected soil. Legionnaire's disease is an example of a disease that can be spread by water that supplies cooling towers and evaporative condensers. How to prevent disease transmission? Because infectious diseases can spread through direct or indirect contact, everyone is at risk of illness. You have a higher risk of becoming ill when you're around sick people or in areas susceptible to germs. If you work in or visit a care center, daycare center, hospital, or doctor's office, take extra precautions to protect yourself. 1. Illness. Something as simple as touching a doorknob, elevator button, light switch, or another person's hand increases the likelihood of coming in contact with germs that can make you sick. The good news is that a few simple precautions can prevent some disease transmission. Wash your hands frequently and thoroughly, use soap and warm water and vigorously rub your hands together for at least 20 seconds. If you can't wash your hands, use an alcohol-based hand sanitizer. Washing your hands is the gold standard though. Other tips to prevent the spread of disease in areas with germs include: wash your hands or use hand sanitizer before handling food and after shaking hands. Always wash with soap and water if your hands are visibly soiled. Try to minimize touching your mouth or nose with your hands. Avoid sick people, if possible. Wear disposable gloves to avoid contact with blood and feces. Use disposable gloves when caring for an ill person. Cover your mouth when you sneeze and cough and wash your hands afterward. Teach children not to put their hands or objects in their mouths. Sanitize toys and changing tables. 2. Foodborne illness. Dangerous organisms can thrive in improperly prepared food. Avoid cross-contamination by keeping raw meats and produce separate. Use different preparation surfaces for raw meats and wash surfaces and utensils thoroughly. Freeze or refrigerate perishable foods and leftovers promptly. According to the United States Department of Agriculture, you should set your refrigerator to 40 degrees Fahrenheit 4 degrees Celsius or below and your freezer to 0 degrees Fahrenheit -18 degrees Celsius or below. Cook meats to a minimum internal temperature of 145 degrees Fahrenheit 63 degrees Celsius. Cook ground meats to 160 degrees Fahrenheit 71 degrees Celsius and poultry to 165 degrees Fahrenheit 73 degrees Celsius. Before traveling, consider researching any foodborne illnesses that may be common in the area you're visiting. It may be helpful to avoid tap water, if possible, and to order meat well done. 3. Insects and animals. When camping or enjoying wooded areas, wear long pants and long sleeves. Use insect repellent and mosquito netting. Don't touch animals in the wild. Don't touch sick or dead animals. After a trek outside in a wooded area, check yourself for ticks. If you find one, remove it. Trusted source using clean, fine-tipped tweezers to grab the tick as close to the skin surface as possible and pull it straight up. 4. Vaccinations. Stay up to date on vaccinations, especially when traveling. Don't forget to keep your pet's vaccinations current, too. Vaccinations can drastically reduce your risk of becoming ill with some infectious diseases. If you can avoid a particular disease, you can also prevent the spread of the disease. There are different types of vaccinations, such as those to prevent measles, mumps, influenza, human papillomavirus. Speak with your doctor to discuss the benefits and risks of these and other vaccinations. Scarlet fever, also known as scarlatina, is an infection that can develop in people who have strep throat. It results when the bacteria release a toxin that causes a rash. Getty Images. Scarlet fever usually causes a sore throat and a bright red rash that may be harder to see in people with darker skin. It typically affects children, but anyone can contract the illness. You can contract it directly with an ill person or in crowded areas like schools or daycares. In the past, scarlet fever could cause complications and even lead to death. These days, when treated with antibiotics, it is typically a mild infection that clears within a few days. Keep reading to learn more information on scarlet fever. What is scarlet fever? Scarlet fever is an infection by the bacteria group A Streptococcus, group A strep. This is the same bacteria that causes strep throat. A bright red rash usually develops on the body, often accompanied by a high fever and sore throat. Scarlet fever mainly affects children ages 5 to 15 years. Trusted source. It used to be a serious childhood illness but is less dangerous today. Antibiotic treatments used early on in the illness can help speed recovery and reduce the severity of the symptoms. Symptoms. A rash is the most common sign of scarlet fever in adults and children. It usually begins as a red blotchy rash and becomes fine and rough like sandpaper. The scarlet-colored rash is what gives scarlet fever its name. The rash can begin up to 2 to 3 days before a person feels ill or up to 7 days later. Trusted source. The rash may be less obvious on darker skin, though you would still be able to feel the bumpy, raised rash. The rash typically begins on the neck, groin, and under the arms. It then spreads to the rest of the body. The folds of skin in the armpits, elbows, and knees can also become a deeper red than the surrounding skin. After the rash has subsided, usually in about 7 days, the skin on the tips of the fingers and toes and in the groin may peel. This can last for several weeks. In addition to the telltale rash, scarlet fever may also cause red creases in the armpits, elbows, and knees, pastillas lines, flushed face, strawberry tongue, which is a white tongue with red dots on the surface, red sore throat with white or yellow patches, fever above 101 degrees Fahrenheit 38.3 degrees Celsius, chills, headaches, swollen tonsils, nausea and vomiting, abdominal pain, swollen glands along the neck, pale skin around the lips. Pictures. Here is what scarlet fever may look like on different skin tones. View all. Scarlet fever causes a telltale red, dotted rash on the skin. Mario D'Ambrogio/Alami stock photo. Causes. Group A Streptococcus or Streptococcus pyogenes bacteria causes scarlet fever. Normally, group A strep causes the typical sore throat or, in some cases, fever. However, the bacteria can sometimes produce a toxin that causes a bright red rash on the body. This is an endotoxin, which means that it is a toxin released when the bacterial cell disintegrates. This is when the disease becomes scarlet fever. Not everyone who gets group A strep will get scarlet fever. Some people are more susceptible to the toxin than others. Is scarlet fever contagious? The infection can spread up to 6 days before a person feels ill and may be spread through contact with droplets from a person's saliva, nasal secretions, sneeze, or cough. This means that any person can contract scarlet fever if they come into direct contact with these infected droplets and then touch their own mouth, nose, or eyes. You may also get scarlet fever if you drink from the same glass or eat with the same utensils as a person with the infection. In some rare cases, group strep infections have spread trusted source through food. Group strep can cause a skin infection in some people. However, this is different from scarlet fever. These skin infections, known as cellulitis, can spread the bacteria to others. However, touching the rash of scarlet fever will not spread the bacteria since the rash is a result of the toxin and not the bacteria itself. Diagnosis. A doctor, nurse practitioner, or physician's assistant will perform a physical exam to check for signs of scarlet fever. During the exam, the doctor will check the condition of your child's tongue, throat, and tonsils. They'll also look for enlarged lymph nodes and examine the appearance and texture of the rash. If the medical professional suspects your child has scarlet fever, they'll likely swab the back of your child's throat to collect a sample of their cells for analysis. This is called a throat swab and is used to create a throat culture. They will then send the sample to a laboratory to determine whether group strep is present. They may also order a rapid antigen detection test that they can perform trusted source in the office. This may help identify a group strep infection while you wait. Treatment. Medical professionals treat scarlet fever with antibiotics. Antibiotics kill bacteria and help the body's immune system fight off the bacteria causing the infection. Make sure you or your child complete the entire course of the prescribed medication. This will help prevent the infection from causing complications or continuing further. For fever and pain, you can also give certain over-the-counter, OTC, medications, such as acetaminophen, Tylenol. Check with the medical team you're working with to see if your child is old enough to receive ibuprofen, Advil, Motrin. Adults may use acetaminophen or ibuprofen. You should not give aspirin to any child under the age of 16 during an illness with a fever due to the increased risk of developing Reye's syndrome. A medical professional might also prescribe other medication to help ease the pain of a sore throat. Home remedies. Other remedies that may help your child feel better include ice pops, ice cream, warm soup, gargling with salt water, cool air humidifier. It's also important that your child drink plenty of water to avoid dehydration. Other steps you can take to treat scarlet fever at home include: try soft foods or a liquid diet if eating is painful. Take OTC acetaminophen, Tylenol, or ibuprofen to ease throat pain. Use OTC anti-itch cream or medication to relieve itching. Suck on throat lozenges. Stay away from irritants in the air, such as pollution. Do not smoke. Your child can return to school after they've taken antibiotics for at least 12 to 24 hours trusted source and no longer have a fever. There's currently no vaccine for scarlet fever or group strep yet, although researchers are currently looking trusted source into potential vaccines. Risk factors and complications. You can get scarlet fever if you encounter someone ill with the infection. Since it is more common in children, risk factors include being in a school, preschool, or another place where many children are present. In theory, you are at an increased risk of catching scarlet fever in crowded areas, especially in closed-off facilities with many people. In most cases, the rash and other symptoms of scarlet fever will be gone in about 7 days trusted source with antibiotic treatment. However, scarlet fever can cause serious complications. These can include rheumatic fever, kidney disease, glomerulonephritis, ear infections, throat abscesses, pneumonia, arthritis. A person has a higher chance of avoiding ear infections, throat abscesses, and pneumonia through prompt antibiotic treatment. Other complications occur due to the body's immune response to the infection rather than the bacteria trusted source. This is called post-streptococcal disorder. Prevention. Practicing good hygiene is the best way to prevent scarlet fever. Here are some prevention tips to follow trusted source and teach your children. Wash your hands before meals and after using the restroom or after coughing or sneezing. Cover your mouth and nose when sneezing or coughing. Avoid sharing utensils and drinking glasses with others, especially in group settings. Stay away or keep your distance from a person you know has scarlet fever. Frequently asked questions. The following sections answer some of your frequently asked questions about scarlet fever. How fatal is scarlet fever? In the past, scarlet fever had a relatively high mortality rate trusted source due to potential complications. Since the development of antibiotics, it has become a much more mild infection that clears within a few days. What is hand, foot, and mouth disease, HFMD? Symptoms, pictures, causes, risk factors, diagnosis, treatment, home remedies, outlook, prevention, Q&A. Hand, foot, and mouth disease is a contagious infection that causes blisters and sores. It tends to occur most often in young children. Hand, foot, and mouth disease, HFMD, is a highly contagious infection. It's caused by viruses from the enterovirus genus, most commonly the Coxsackie virus. These viruses can spread from person to person through direct contact with unwashed hands or surfaces contaminated with feces. It can also be transmitted through contact with a person's saliva, stool, or respiratory secretions. HFMD is characterized by blisters or sores in the mouth and a rash on the hands and feet. The infection can affect people of all ages, but it usually occurs in children under age 5. It's generally a mild condition that goes away on its own within several days. What are the symptoms of hand, foot, and mouth disease? Symptoms begin to develop 3 to 6 days after first getting the infection. This period is known as the incubation period. When symptoms do appear, you or your child may experience fever, decreased appetite, sore throat, headache, irritability, malaise, feeling unwell, painful red blisters in your mouth, drooling, a red rash on your hands and the soles of your feet. A fever and sore throat are usually the first symptoms of HFMD. The characteristic blisters and rashes show up later, usually 1 or 2 days after the fever begins. The rash usually looks like flat red spots. The spots can be harder to see on darker skin tones, so it's easier to check the palms of hands and the bottom of feet where the condition may be more noticeable. Lesions can appear on all surfaces of your hands and feet, but this is one of the few times a rash on your palms and soles occurs, which is why it's easy to identify. Most children with HFMD will also have painful sores in the mouth. Check their tongue, including the sides and throat. Pictures of hand, foot, and mouth disease symptoms. View gallery. 5. What causes hand, foot, and mouth disease? HFMD is often caused by a strain of Coxsackie virus, most commonly Coxsackie virus A16. The Coxsackie virus is part of a group of viruses called enteroviruses. In some cases, other types of enteroviruses can cause HFMD. Viruses can be easily spread from person to person. You or your child may get HFMD through contact with a person's saliva, fluid from blisters, feces, respiratory droplets that are sprayed into the air after coughing or sneezing. HFMD can also be transmitted through direct contact with unwashed hands or a surface containing traces of the virus. Who is at risk for hand, foot, and mouth disease? Young children have the highest risk for getting HFMD. Risk increases if they attend day care or school, as viruses can spread quickly in these facilities. Children usually build up immunity to the disease after being exposed to the viruses that cause it. This is why the condition rarely affects people over age 10. However, it's still possible for older children and adults to get the infection, especially if they have weakened immune systems. How is hand, foot, and mouth disease diagnosed? A doctor can often diagnose HFMD by performing a physical exam. They'll check your mouth and body for the appearance of blisters and rashes. The doctor will also ask you or your child about other symptoms. The doctor may take a throat swab or stool sample to test for the virus. This will allow them to confirm the diagnosis. How is hand, foot, and mouth disease treated? In most cases, the infection will go away without treatment in 7 to 10 days. However, your doctor may recommend certain treatments to help ease symptoms until the disease has run its course. These can include prescription or over-the-counter topical ointments to soothe blisters and rashes, pain medication, such as acetaminophen or ibuprofen, to relieve headaches, medicated syrups or lozenges to ease painful sore throats. You shouldn't give aspirin to children for viral infections. Aspirin can lead to Reye syndrome in children. Home remedies for hand, foot, and mouth disease. Certain at-home treatments can also provide relief from HFMD symptoms. You can try the following home remedies to help make blisters less bothersome. Sucking on ice chips or popsicles. Eating ice cream or sherbet. Drinking cold beverages. Limiting citrus fruits, fruit drinks, and soda. Limiting spicy or salty foods. Swishing warm salt water around in your mouth may also help relieve the pain associated with mouth blisters and throat sores. You can do this several times a day or as often as needed. Hand, foot, and mouth disease outlook. You or your child should feel completely better 7 to 10 days after the initial onset of symptoms. Getting the infection again is uncommon. The body usually builds up immunity to the viruses that cause the disease. Call a doctor immediately if symptoms get worse or don't clear up within 10 days. In rare cases, Coxsackie virus can cause a medical emergency. Potential complications of HFMD include dehydration, fingernail or toenail loss, viral meningitis, encephalitis, paralysis, myocarditis. Can hand, foot, and mouth disease be prevented? Practicing good hygiene is the best defense against HFMD. Regular handwashing can greatly reduce your risk of getting this virus. You can teach your children how to wash their hands using hot water and soap. Washing your hands after using the restroom, before eating, and after being out in public is important. Children should also not put their hands or other objects in or near their mouths. It's important to disinfect any common areas in your home on a regular basis. Try cleaning shared surfaces first with soap and water, then with a diluted solution of bleach and water. You should also disinfect toys, pacifiers, and other objects that may be contaminated with the virus. If you or your child experience symptoms such as a fever or sore throat, stay home from school or work. It's best to avoid contact with others once the blisters and rashes develop. This can help you avoid spreading the disease to others. How long is hand, foot, and mouth disease contagious? Question. My daughter has HFMD. How long is the virus contagious, and when can she start going back to school? Anonymous patient. A. People with HFMD are most likely to pass on the infection during the first week of the illness. They can sometimes still pass it on for a few weeks after symptoms go away, but this is less likely. Your child should stay at home until her symptoms resolve. She may then return to school, but she'll still need to limit close contact with her peers, including allowing others to eat or drink after her. She should wash her hands frequently and try not to rub her eyes or mouth, as the virus can be transmitted through body fluids. Mark Laflamme, MD. Answers represent the opinions of our medical experts. All content is strictly informational and should not be considered medical advice. Mouth sores, symptoms, treatment, and prevention. Pictures of mouth sores. Symptoms. Causes. Diagnosis. Natural remedies. Medical treatment. Prevention. Long-term effects. FAQ. Takeaway. We include products we think are useful for our readers. If you buy through links on this page, we may earn a small commission. Here's our process. How we vet brands and products. Mouth sores have many possible causes, such as infections, allergies, trauma, and tobacco use. Seek medical attention for certain mouth sores, including ones that have white patches or that develop after you start a new medication. In this article, learn about the causes of mouth sores, see some pictures to help you identify them, and get some tips on treating them. What are mouth sores? Mouth sores are common ailments that affect many people at some point in their lives. These sores can appear on any of the soft tissues of your mouth, including the lips, inside of your cheeks, gums, tongue, and floor and roof of your mouth. Mouth sores, which include canker sores, are usually a minor irritation and last only 1 or 2 weeks. In some cases, they can indicate an infection from a virus, such as herpes simplex, or more severe causes, such as mouth cancer. Sores in your mouth may be trusted source caused by a common or short-lasting condition such as canker sores, cold sores, gingivostomatitis, infectious mononucleosis, mono, folate deficiency or anemia, oral thrush, hand, foot, and mouth disease, leukoplakia, an allergy or reaction to food or medication, trauma or burns. Mouth sores may also be caused by a long-lasting condition or a more serious disease, including trusted source. Celiac disease, mouth cancer, pemphigus vulgaris. Keep reading to learn about the causes and symptoms of mouth sores and how to recognize and get rid of them. What do mouth sores look like? Different conditions can cause mouth sores, according to the Merck manual. They may look different depending on the cause. Mouth sores can appear a different color than the surrounding tissue, including white, yellow, red, or purple. The following images show different types of mouth sores. These images are not intended to provide a diagnosis. If you have unexplained mouth sores or mouth sores that come back or last for a long time, it is best to visit a doctor for a diagnosis and treatment. Warning: images of mouth sores ahead. Warning, images of mouth sores ahead. Was this helpful? Canker sores. Canker sores may look like small oval-shaped ulcers in your mouth that appear white, gray, or yellow. They may be surrounded by a red halo of irritation. They may also appear as a painful red area. A canker sore is a small shallow ulcer on the inside of your mouth. Frank 600/Getty Images. Canker sores are also called aphthous stomatitis or aphthous ulcers. According to 2021 research, they are common and affect about 20% trusted source of the general population. They are usually harmless and heal on their own in a couple of weeks. If you have recurring ulcers, it may be due to other conditions, such as Crohn's disease, celiac disease, vitamin deficiency, or HIV. Canker sores may be classified by their size trusted source. This can include mild, which are less than 1 centimeter in diameter and heal within 1 to 2 weeks. Major, which are deeper and larger, 2 to 3 centimeters in diameter and can take weeks or months to heal. Herpetiform, which are smaller, 1 to 2 millimeters in diameter, but occur in clusters of 10 to 100 and can take a few weeks to heal. What causes canker sores in your mouth? Canker sores are commonly caused by trauma like biting the inside of your cheek, burns, allergies, or sensitivities. They may have other causes as well. However, canker sores are not contagious. Certain conditions may make you more prone to them. These can include a weakened immune system because of illness or stress, hormone changes, such as menstruation, a vitamin deficiency, especially of folate and B12, intestinal issues, such as Crohn's disease or irritable bowel syndrome, IBS, exposure to toxins in drinking water, emotional or psychological stress, smoking or a history of smoking, cold sores. Cold sores look like fluid-filled blisters that appear near the mouth and lips. They can appear red or darker in color. The affected area may tingle or burn before the sore is visible. Cold sores are tiny blisters that appear on the lip. Getty Images. Photo of cold sore. NHS England. Cold sores are caused by the herpes simplex type 1 virus, HSV1. Outbreaks may also be accompanied by mild, flu-like symptoms, such as low fever, body aches, and swollen lymph nodes. This virus can be dormant inside of your body. Sores may appear when the virus reactivates and last for 2 to 6 trusted source weeks, according to 2021 research. This can occur when the immune system is weak or during times of stress. Outbreaks are more common if you are under stress, are ill or have a weakened immune system, have had too much sun exposure, have a break in the skin of your mouth. The virus that causes cold sores is contagious and can be spread through contact with cold sores. It can be spread through kissing, sharing food, or sharing cosmetics. It is also possible to catch HSV1 when sores cannot be seen. Genital herpes, caused by the herpes simplex type 2 virus, HSV2, can look similar in appearance to cold sores. Both viruses may be spread through sex without a condom or other barrier method if you or your partner has an active outbreak. Folate deficiency and anemia. A folate deficiency is caused by not having enough folate, also known as vitamin B9. Folate is an important B vitamin used to make and repair DNA. It's critical to proper development in embryos. Being deficient in folate can also lead to folate deficiency anemia. Anemia occurs when your supply of red blood cells is too low. When your red blood cells are reduced, damaged, or impaired, you may have problems transporting enough oxygen throughout your body. It can have an impact on different organ systems in your body. Both folate deficiency and anemia can cause mouth sores. While folate deficiency can cause anemia, other types of anemia, like iron deficiency anemia, can cause mouth sores as well. These sores may look like small mouth ulcers or canker sores and be white, gray, yellow, or red in color. Anemia can cause mouth ulcers. Twan_Aziza/Shutterstock. Anemia can present in many ways, including skin changes. Casa Nayafana/Shutterstock. Folate deficiency may also cause additional symptoms, including fatigue, weakness, pale skin, tongue swelling, gray hair, growth delay in children. Anemia can also cause additional symptoms that may include pale, cold skin, pale gums, dizziness, lightheadedness, fatigue, increased or decreased blood pressure, racing or pounding heart. Anemia has many causes and may occur quickly or over a long period of time. Anemia that occurs quickly may be caused by blood loss from injury, surgery, endometriosis, childbirth, heavy menstrual periods, gastrointestinal conditions such as ulcers, IBS, and cancer. Chronic anemia may be related to autoimmune diseases, inherited genetic conditions, overexposure to lead, and other conditions. Gingivostomatitis. Gingivostomatitis is a common infection of the mouth and gums, often seen in children. It produces tender sores on the gums or insides of the cheeks. Like canker sores, they can appear grayish or yellow on the outside and red in the center. Pain can range from mild to severe. Swelling and sores in the mouth is known as gingivostomatitis. James Heilman, MD, CC by SA 3.0, via Wikimedia Commons. If you have gingivostomatitis, you may also experience mild, flu-like symptoms. These sores may also lead to drooling and pain with eating. Young children may refuse to eat. Ulcers caused by this condition can last about 2 to 3 weeks. Trusted source, according to 2021 research. Gingivostomatitis is often caused by viral infections, such as HSV-1 and Coxsackie virus, and bacterial infections, such as Streptococcus. These infections can also be caused by not flossing and brushing teeth regularly. Infectious mononucleosis. Infectious mononucleosis, also known as mono, can occur with a rash. This rash can occur on the skin or inside of your mouth. Flat spots may appear pink or purple. Infectious mononucleosis is caused by the Epstein-Barr virus, EBV. It often affects adolescents and young adults in high school and college. Infectious mono presents with sore throat with discharge. Another average Joe/Getty images. Symptoms typically last for 2 to 4 weeks but may last weeks longer, according to the Centers for Disease Control and Prevention, CDC, trusted source. Symptoms may also include fever, swollen lymph glands, sore throat, headache, fatigue, night sweats, body aches. Oral thrush. Oral thrush is a yeast infection that develops on the inside of your mouth and on your tongue. It's most common in infants and children, but it may be a sign of a weakened immune system in adults. Having dry mouth or taking medications like antibiotics may increase your risk of developing it. It looks like creamy white bumps that appear on the tongue, inner cheeks, gums, or tonsils and can be scraped off. Oral thrush appears as white fungus on the tongue. Victoria 1/Shutterstock. Oral thrush is caused by an overgrowth of candida, a type of yeast that naturally occurs in the body. The CDC says this condition is usually treated with antifungal medications for 7 to 14 days. Trusted source. Additional symptoms may include pain at the site of the bumps, cotton-like feeling in the mouth, loss of taste, pain while swallowing or eating, dry, cracked skin at the corners of the mouth, hand, foot, and mouth disease. Hand, foot, and mouth disease is caused by viruses in the enterovirus family. It's common in children under the age of 5. It causes painful red blisters in the mouth and on the tongue and gums. You may also experience flat or raised red spots located on the palms of the hands, soles of the feet, buttocks, or genital area. On darker skin tones, bumps may appear skin-colored or grayish-brown in color. Hand, foot, and mouth disease presents as mouth sores with rash on the hands and feet. Adriatic Photo/Shutterstock. Other symptoms may include fever, sore throat, feeling unwell, skin rash. Hand, foot, and mouth disease is contagious but usually not serious. It usually resolves in 7 to 10 days. Trusted source, according to the CDC. The infection is more contagious during the first week. Leukoplakia. Oral leukoplakia is a white patch that develops in the mouth. It is common in people who use tobacco of all kinds. Leukoplakia may look like thick, white patches on your tongue and the lining of your mouth. They may be raised, hard, or have a hairy appearance. Oral leukoplakia resembles a white patch. Photography courtesy of Michael Gaither/Wikimedia. Leukoplakia can be harmless and often goes away on its own. But 2021 research suggests 1 to 9% trusted source of people with this condition may develop oral cancer. If you have this condition, visit a doctor, who may take a sample of the cells for diagnosis. Regular dental appointments may help catch leukoplakia. Oral lichen planus. Oral lichen planus is a chronic inflammatory disorder that affects the mucous membranes of the gums, lips, cheeks, and tongue. It may cause white, lacy, raised patches of tissue in the mouth that can resemble spiderwebs. It may also cause tender, swollen patches that are bright red with ulcers. Open ulcers may bleed and cause pain when you eat or brush your teeth. They may also burn or sting. Lichen planus causes a lacy white rash which can present in the mouth. Dermatology 11/Getty Images. Lichen planus is not contagious. However, it is a chronic condition that cannot be cured. Medication, such as corticosteroids and immune response medications, along with using a mild toothpaste, may help manage symptoms. Celiac disease. Celiac disease is an atypical immune system response to gluten that can damage the lining of the small intestine. Damage to the villi, the small hair-like threads in your small intestine, may lead to poor absorption of important dietary nutrients like B vitamins, vitamin D, iron, and calcium. Vitamin deficiency can lead to conditions like anemia. This may increase your risk of developing mouth ulcers. Celiac disease is caused by a reaction to gluten, which presents with abdominal pain and gastrointestinal symptoms. Vicky Smith/Getty Images. Symptoms range in severity and may differ between adults and children. They can include diarrhea, weight loss, stomach pain, anemia, joint pain, bloating, gassiness, fatty stools, skin rash, mouth sores. In children, symptoms may include weight loss, growth delay, delayed puberty, chronic diarrhea or constipation, stomach pain, yellow or discolored teeth. Celiac disease is a chronic condition and has no cure. You can manage celiac disease through diet and avoiding gluten-containing ingredients such as wheat, barley, rye, and triticale. People with celiac disease may also experience symptoms from cross-contamination with these ingredients. Mouth cancer. Mouth cancer, or oral cancer, is a type of cancer that originates in the mouth or oral cavity. This includes the lips, cheeks, teeth, gums, front 2/3 of the tongue, roof, and floor of the mouth. Cancer is caused by the growth and spread of abnormal cells. Oral cancer may look like ulcers, white patches, or red patches that appear inside the mouth or on the lips and do not heal. Doctors use the terms leukoplakia and erythroplakia to describe these tissue changes inside the mouth. Other symptoms of oral cancer may include weight loss, bleeding gums, ear pain, swollen lymph nodes in the neck. If you have unexplained white patches inside your mouth, visit a doctor. They can perform a biopsy to check for cancerous or precancerous cells. Early detection of cancers such as oral cancer can improve your outlook. Pemphigus vulgaris. Pemphigus vulgaris is a rare autoimmune disease. Having an autoimmune disease means that your body's immune system mistakenly attacks healthy tissue in your body. Pemphigus vulgaris affects the skin and mucous membranes of the mouth, throat, nose, eyes, genitals, anus, and lungs. It can cause painful, itchy skin blisters that break and bleed easily. Blisters in the mouth and throat may cause pain with swallowing and eating. Skin blisters caused by pemphigus vulgaris. Photography by DermNet New Zealand. Symptoms of pemphigus vulgaris can include blisters that start in the mouth or on skin, blisters that may come and go, blisters that ooze, crust, or peel. Treatment usually involves systemic corticosteroids. They typically take effect within 3 months, according to 2021 research trusted source. What are the symptoms of mouth sores? In most cases, mouth sores cause some redness and pain, especially when eating and drinking. They can also cause a burning or tingling sensation around the sore. Depending on the size, severity, and location of the sores in your mouth, they can make it difficult to eat, drink, swallow, talk, or breathe. The sores may also develop blisters. Contact a healthcare professional if you experience any of the following symptoms. Sores that are larger than ½ an inch in diameter. Frequent outbreaks of mouth sores. Rash. Joint pain. Fever. Diarrhea. What causes mouth sores? Several things can lead to mouth sores, ranging from minor everyday causes to serious illnesses. Usually, a mouth sore might develop if you bite your tongue, cheek, or lip, burn your mouth, experience irritation from a sharp object, such as braces, a retainer, or dentures, brush your teeth too hard or use a very firm toothbrush, use chewing tobacco or smoke cigarettes, have the herpes simplex virus. Occasionally, mouth sores are the result of or a reaction to the following: over-the-counter or prescription medications, such as antibiotics or corticosteroids, gingivostomatitis, infectious mononucleosis, oral thrush, hand, foot, and mouth disease, radiation or chemotherapy, autoimmune disorders, bleeding disorders, cancer, celiac disease, bacterial, viral, or fungal infection. A weakened immune system due to AIDS or a recent organ transplant. Do mouth sores need to be diagnosed? You can usually tell when you have a mouth sore without needing a healthcare professional's diagnosis. However, contact a healthcare professional if you have white patches on your sores, as this may be a sign of leukoplakia or oral lichen planus. Have or suspect you have herpes simplex or another infection. Have sores that don't go away or get worse after a couple of weeks. Started taking a new medication. Started cancer treatment. Recently had transplant surgery. During your visit, a healthcare professional will examine your mouth, tongue, and lips. If they suspect you have cancer, they may perform a biopsy and run some tests. How to get rid of mouth sores naturally. Minor mouth sores often go away naturally within 1 to 2 weeks. Some simple home remedies might help reduce the pain and possibly speed up the healing process. You may want to avoid hot, spicy, salty, citrus-based, and high-sugar foods. Avoid tobacco and alcohol. Gargle with salt water. Eat ice pops, sherbet, or other cold foods. Take a pain medication, such as acetaminophen, Tylenol. Avoid squeezing or picking at the sores or blisters. Apply a thin paste of baking soda and water. Gently dab on a solution that is 1 part hydrogen peroxide and 1 part water. Ask your pharmacist about other over-the-counter medications, pastes, or mouthwashes that may be helpful. Mouth sore medications. If you see a healthcare professional for your mouth sores, they may prescribe a pain medication, anti-inflammatory drug, or steroid gel. If your mouth sores are a result of a viral, bacterial, or fungal infection, your healthcare professional might provide a medication to treat the infection. In cases of mouth cancer, a biopsy will be taken first. Afterward, you may need surgery or chemotherapy. Can mouth sores be prevented? There is no absolute way to prevent all mouth sores. However, you can take certain steps to lower the chance of getting them. These may include avoiding very hot foods and drinks, chewing slowly, using a soft toothbrush and practicing regular dental hygiene, contacting your dentist if any dental hardware or teeth may be irritating your mouth, decreasing stress, eating a balanced diet, reducing or eliminating food irritants such as hot, spicy foods, taking vitamin supplements, especially B vitamins, drinking plenty of water, avoiding smoking or using tobacco, avoiding or limiting alcohol consumption, shading your lips when in the sun, or using SPF 15 lip balm. Are there any long-term effects of mouth sores? In most cases, mouth sores have no long-term effects. In some cases, they may leave scarring. If you have herpes simplex, the sores may reappear. Cold sores may also cause scarring. In cases of cancer, your long-term side effects and outlook depend on the type, severity, and treatment of your cancer. Frequently asked questions. What are 4 types of mouth sores? Mouth sores can happen for many reasons, including infections, medication use, allergies, having a weakened immune system, cancer. How do you heal sores in your mouth? A doctor may prescribe medication to address an underlying issue. Some lifestyle tips for treating and preventing mouth sores include gargling with salt water, avoiding smoking and other tobacco use, applying a paste of baking soda and water. What viruses can cause mouth sores? Viruses that can lead to mouth sores include HSV1, HSV2, HIV and AIDS due to a weakened immune system, mononucleosis, hand, foot, and mouth disease. When should I be concerned about mouth sores? It's best to see a doctor if you have sores that recur often, are large and very painful, do not go away or get worse, occur with other symptoms, such as a fever. How long do mouth sores last? This will depend on the cause. Canker sores usually resolve within 1 to 2 weeks. Trusted source, but can take longer. If a sore lasts longer than 2 weeks and does not appear to be healing, it is best to see a doctor. Takeaway. Mouth sores are common and usually last only 1 or 2 weeks. They can make eating and drinking painful. Some over-the-counter rinses, gels, or medications may help. Severe or recurring mouth sores may be a sign of a chronic or more serious condition. If you have frequent unexplained mouth sores or mouth sores that won't go away, contact a doctor for a diagnosis and treatment. Everything you need to know about fifth disease. Causes, pictures, symptoms, diagnosis, treatment. In adults, during pregnancy, in babies, contagious, outlook, prevention. Sixth disease, scarlet fever. Q&A, stopping the transmission. Fifth disease is a viral illness causing a red rash on the arms, legs, and cheeks. It's common and mild in most children. It can be severe in pregnant people or those with a compromised immune system. Fifth disease is also known as the slapped cheek disease. Most doctors advise people with fifth disease to wait out the symptoms. This is because there's currently no medication that'll shorten the course of the disease. However, if you have a weakened immune system, your doctor may need to closely monitor you until the symptoms disappear. Read on to find out why fifth disease develops, who is most at risk, how to know when that red rash may be a sign of something more serious. What causes fifth disease? Parvovirus B19 causes fifth disease. This airborne virus tends to spread through saliva and respiratory secretions among children who are in elementary school. Its most common trusted source in late winter, spring, early summer. However, it can spread at any time and among people of any age. Many adults have antibodies that prevent them from developing fifth disease because of previous exposure during childhood. When contracting fifth disease as an adult, the symptoms can be severe. If you get fifth disease while pregnant, there are serious risks for your unborn baby, including life-threatening anemia. For children with healthy immune systems, fifth disease is a common, mild illness that rarely presents lasting consequences. What does fifth disease look like? What are the symptoms of fifth disease? The initial symptoms of fifth disease are very general. They may resemble mild symptoms of the flu. Symptoms often include headache, fatigue, low-grade fever, sore throat, nausea, runny nose, stuffy nose. According to the Arthritis Foundation, symptoms tend to appear 4 to 14 days after exposure to the virus. After a few days of having these symptoms, most young people develop a red rash that first appears on the cheeks. Sometimes the rash is the first sign of the illness that's noticed. The rash tends to clear up on one area of the body and then reappear on another part of the body within a few days. In addition to the cheeks, the rash will often appear on the arms, legs, trunk of the body. The rash may last for weeks. But, by the time you see it, you're usually no longer contagious. Children are more likely to get a rash than adults. In fact, the main symptom adults usually experience is joint pain. Joint pain can last for several weeks. It's usually most noticeable in the wrists, ankles, knees. How is fifth disease diagnosed? Doctors can often make the diagnosis by simply looking at the rash. Your doctor may test you for specific antibodies if you're likely to face serious consequences from fifth disease. This is especially true if you're pregnant or have a compromised immune system. How is fifth disease treated? For most healthy people, no treatment is necessary. If your joints hurt or you have a headache or fever, you may be advised to take over-the-counter, OTC, acetaminophen, Tylenol, as needed to relieve these symptoms. Otherwise, you'll need to wait for your body to fight off the virus. This usually takes 1 to 3 weeks. You can help the process along by drinking a lot of fluids and getting extra rest. Children can often return to school once the red rash appears since they're no longer contagious. In rare instances, intravenous immunoglobulin, IVIG, can be administered. This treatment is usually reserved for severe, life-threatening cases. Fifth disease in adults. While fifth disease usually affects children, it can occur in adults. As with children, fifth disease in adults is almost always mild. Symptoms include joint pain and swelling. A mild rash might occur, but a rash isn't always present. Some adults with fifth disease experience no symptoms at all. Treatment for these symptoms is typically OTC pain medication, such as Tylenol and ibuprofen. These medications can help reduce swelling and joint pain. Symptoms often improve on their own within 1 or 2 weeks, but they may last for several months. Adults rarely experience problems with fifth. Women who are pregnant and adults with a weak immune system or chronic anemia may experience complications if they contract fifth disease. Fifth disease during pregnancy. Most people who come into contact with the virus that causes fifth disease and those who later develop an infection will have no problem as a result. According to the Centers for Disease Control and Prevention, CDC, roughly 50% of pregnant women trusted source are immune to the virus, so they won't develop fifth disease even if they're exposed. In those who aren't immune, exposure could mean mild illness. Symptoms may include joint pain, swelling, a mild rash. A developing fetus is unlikely to be affected, but it's possible for a mother to transmit the condition to her unborn child. In rare cases, a fetus whose mother has contracted parvovirus B19 can develop severe anemia. This condition makes it difficult for the developing fetus to make red blood cells, RBCs, and it could lead to miscarriage. Miscarriage caused by fifth disease is not common. Less than 5% of pregnant women trusted source who contract fifth disease will lose their fetus. Miscarriage usually occurs in the first trimester, or first 3 months, of pregnancy. There's no treatment for fifth disease during pregnancy. However, your doctor will likely request additional monitoring. This may include more prenatal visits, additional ultrasounds, regular blood work. Fifth disease in babies. Mothers who are diagnosed with fifth disease can transmit the virus to their developing fetus. If this happens, the baby could develop severe anemia. However, this is rare. Babies with anemia caused by fifth disease may require a blood transfusion. In some cases, condition could cause stillbirth or miscarriage. If a baby contracts fifth disease in utero, there's no treatment. The doctor will monitor the mother and fetus throughout the pregnancy. The baby will likely receive additional medical care after delivery, including a blood transfusion if necessary. When is fifth disease contagious? Fifth disease is contagious in the earliest phase of the infection, before telltale symptoms like a rash appear. It's transmitted through respiratory secretions, such as saliva or sputum. These fluids are commonly produced with a runny nose and sneezing, which are early symptoms of fifth disease. This is why fifth disease can be transmitted so easily and so rapidly. It's only when a rash appears, if one does, that it could become clear that the symptoms are not the result of a common cold or flu. Rashes typically appear 2 to 3 weeks after exposure to the virus. By the time a rash appears, you're no longer contagious. Outlook. Fifth disease has no long-term consequences for most people. However, if your immune system is weakened due to HIV, chemotherapy, or other conditions, you'll likely need to be under a doctor's care as your body works to fight off the disease. If you have anemia before getting fifth disease, you'll likely need medical attention. This is because fifth disease can stop your body from producing RBCs, which can reduce the amount of oxygen that your tissue gets. This is especially likely in people with sickle cell anemia. See a doctor right away if you have sickle cell anemia and think you may have been exposed to fifth disease. It can be dangerous if you develop the condition during pregnancy. Fifth disease can harm your developing fetus if they develop a severe form of anemia called hemolytic anemia. It can lead to a condition called hydrops fetalis. Your doctor may recommend an intrauterine transfusion via cordocentesis trusted source. This is a blood transfusion that's done through the umbilical cord to help protect the unborn child from the disease. According to the March of Dimes, other pregnancy-related complications may include heart failure, miscarriage, stillbirth. How can fifth disease be prevented? Since fifth disease is usually transmitted from one person to another through airborne secretions, try to minimize contact with people who are sneezing, coughing, blowing their noses. Washing your hands frequently can also help reduce the chances of contracting fifth disease. Once a person with a healthy immune system has contracted this disease, they're considered immune for life. Fifth disease versus sixth disease. Roseola, also known as sixth disease, is a viral illness most commonly caused by human herpes virus 6, HHV6. It's most common in children ages 6 months to 2 years. About 90% of cases of sixth disease trusted source are in children younger than 2 years old. The first symptom of roseola will likely be a high fever, about 102 to 104 degrees Fahrenheit. It may last for 3 to 5 days. After the fever subsides, the telltale rash will develop across the trunk and often up to the face and out to the extremities. The rash is pink or red in color, bumpy and blotchy looking. Fifth disease and roseola have a rash in common, but other symptoms of roseola set these two infections apart. Other symptoms can include runny nose, eyelid swelling, irritability, tiredness. Like fifth disease, roseola has no specific treatment. Your child's doctor will likely recommend treating the fever with over-the-counter acetaminophen. You may also use liquids and other comforting techniques to keep the child comfortable until the fever and rash pass. Children with sixth disease will rarely experience complications. The most common is a febrile seizure as a result of the high fever. Children who have a compromised immune system may have additional complication risks if they contract roseola. Fifth disease versus scarlet fever. Scarlet fever, like fifth disease, is a common cause for red skin rashes in children. Unlike fifth disease, scarlet fever is caused by bacteria, not a virus. It's the same bacteria that causes strep throat. About 10% of children with strep throat will have a more severe reaction to the bacteria and develop scarlet fever. Symptoms include sudden onset of fever, sore throat, possibly vomiting. Within a day or two, a red rash with small red or white bumps will appear, typically first on the face. Then it can spread to the trunk and limbs. A white strawberry tongue is also common in children with scarlet fever. This looks like a thick white coating with raised red papillae, or red bumps, on the surface of the tongue. Children between ages 5 and 15 are most likely to develop scarlet fever. However, you can develop scarlet fever at any age. Scarlet fever can be treated with antibiotics, which can prevent severe complications like rheumatic fever. Like fifth disease, scarlet fever is transmitted through respiratory droplets. Children who show signs of scarlet fever should stay home and avoid other kids until they have been fever-free and taking antibiotics for at least 24 hours. Q&A. Question. My child was recently diagnosed with fifth disease. How long should I keep her out of school to prevent it from spreading to other children? Anonymous patient. A. According to the Centers for Disease Control and Prevention trusted source, people with parvovirus B19, which causes fifth disease, usually develop symptoms between 4 and 14 days after exposure. Initially, children may have a fever, malaise, or cold symptoms before the rash breaks out. The rash can last for 7 to 10 days. Children are most likely to spread the virus early in the disease before the rash even develops. Then, unless your child has immune problems, they're probably no longer infectious and can go back to school. The full lowdown on heat rash. What it looks like. Pictures. Treatment. Symptoms. Causes. Call your doctor. Prevention. A heat rash typically looks like small clear, white, or red bumps on your skin. These bumps are sometimes filled with fluid. They can show up anywhere that you sweat a lot, like under the breasts, the groin, or the face. What is heat rash? Heat rash is a skin condition that often affects children and adults in hot, humid weather conditions. You can develop heat rash when your pores become blocked and sweat can't escape. Many different types of skin rashes exist. They can be concerning, uncomfortable, or downright painful. Heat rash is one of the most common types. Alexandra Barasenka/IM/Getty Images. What does heat rash look like? Different types of heat rash can range in severity, and they all look a little different. Miliaria crystallina. This is the most common and mildest form of heat rash. If you have miliaria crystallina, you'll notice small clear or white bumps filled with fluid on the surface of your skin. These bumps are bubbles of sweat that often burst. Contrary to popular belief, this type of heat rash doesn't itch and shouldn't be painful. Miliaria crystallina is more common in young infants than in adults. Miliaria rubra. This type, or prickly heat, is more common in adults than in children and babies. Miliaria rubra is known to cause more discomfort than miliaria crystallina because it occurs deeper in the outer layer of the skin. Miliaria rubra occurs in hot or humid conditions and may cause itchy or prickly sensations, red bumps on the skin, a lack of sweat in the affected area, inflammation and soreness of the skin because the body can't release sweat through the skin's surface. Bumps that appear due to miliaria rubra can sometimes progress and fill with pus. When this happens, doctors refer to the condition as miliaria pustulosa. Miliaria profunda. Miliaria profunda is the least common form of heat rash. It can recur often and become chronic, or long-term. This form of heat rash occurs in the dermis, which is the deeper layer of skin. Miliaria profunda typically occurs in adults after a period of physical activity that produces sweat. If you have miliaria profunda, you'll notice large, tough, flesh-colored bumps. Because heat rash prevents sweat from leaving your skin, it may lead to nausea and dizziness. Pictures. These images show the difference between the three types of heat rash. View gallery. 2. Treatment of heat rash. Heat rash usually resolves without treatment in a few days. If the discomfort becomes too severe, you can try methods at home that help soothe itching and reduce skin temperature. Some medicines/creams you can buy to manage heat rash include over-the-counter, OTC, hydrocortisone cream applied 1 to 2 times a day can help soothe itching. OTC antihistamines can also take an effect against itching. 8 Home remedies for heat rash. Aside from OTC medications and creams, there are a number of herbal or non-medicinal remedies that might soothe the redness and itching. These include: apply a cold compress. Using an ice pack or chilled cloth can help you bring down redness, swelling, and itching. If using an ice pack, be sure to wrap it in a towel or old t-shirt. You don't want to experience freeze or burn. Take a low-temperature bath. A cold or lukewarm shower can also help you reduce the temperature of your skin and soothes itching. It might help to try an exfoliant to help open the affected pores. Keep indoor temperatures cool. Use a fan or air conditioning to cool down your room. If you're on bed rest, it's important to move around to let air circulate your body. Stick with loose, cotton clothing. This allows air to move around your body and keep it cool. Choosing lightweight, breathable, natural fabrics rather than synthetics might also help you avoid irritation and stay comfortable. Take a colloidal oatmeal bath. A 2015 study trusted source of colloidal oatmeal extract suggests that the possible anti-inflammatory and antioxidant effects of oat might be behind its potential itch-soothing effects. Use topical pine tar. Used by people to manage skin conditions for thousands of years, applying pine tar to itchy or inflamed areas can reduce itching and inflammation, according to one 2016 review trusted source. Apply aloe vera gel to the area. Aloe vera is another well-established topical remedy for skin ailments that may help soothe your itchy skin. Mix sandalwood with water and applying the paste to your heat rash. An older 2011 study found that sandalwood, a herb common to Ayurvedic traditional medicine, might help you reduce inflammation across a number of skin conditions. Symptoms of heat rash. Heat rash often causes symptoms in sweat-prone areas, like the face, the neck, underneath the breasts, beneath your scrotum. The symptoms can involve small raised spots called papules, an itching sensation, slight swelling. On lighter skin, the spots may appear red. On darker skin, the spots can be more understated and harder to identify on darker skin, but a dermatologist or physician will be able to see them using a dermoscopy, where they use a small, lighted microscope to zoom in on the skin. For people with darker skin, the spots might appear as white globules with darker halos around them. What causes heat rash? Heat rash occurs when pores become clogged and can't expel sweat. This is more likely to happen in warmer months or climates, or after intense exercise. Wearing certain types of clothing can trap sweat, leading to heat rash. Using thick lotions and creams can also lead to heat rash. It's possible to get heat rash in cooler temperatures if you wear clothes or sleep under covers that lead to overheating. Babies are more likely to develop heat rash because their pores are underdeveloped. Friction on the surface of the skin often causes heat rash. Adults usually develop heat rash on the parts of their bodies that rub together, like between the inner thighs or under the arms. Babies often develop heat rash on their necks, but it can also develop in skin folds like those of the armpits, elbows, and thighs. Risk factors. Having certain health problems or engaging in certain lifestyle choices can increase your risk for heat rash, including trusted source. Being prone to intense sweating. Regularly engaging in high-intensity physical activity. Taking drugs that trigger sweating like bethanechol, clonidine, and neostigmine. Morvan syndrome, a rare genetic disorder that causes excessive sweating. Type 1 pseudohypoaldosteronism, a condition that causes a loss of sodium through the sweat glands that has some links to heat rash. When should you call your doctor? Heat rash is rarely serious. Often, it goes away without treatment in a few days. But you should call your doctor if you begin to experience a fever, chills, increased pain, pus draining from the bumps. Call your child's doctor if your child has a heat rash that doesn't resolve in a few days. Your doctor may recommend that you apply lotions like calamine or lanolin to relieve itching and prevent further damage. Keep their skin cool and dry to help relieve heat rash. Prevention. Follow these tips to prevent heat rash. Avoid wearing tight clothing that doesn't allow your skin to breathe. Moisture-wicking fabrics may help prevent sweat buildup on the skin. Don't use thick lotions or creams that can clog your pores. Try not to become overheated, especially in warmer months. Seek out air conditioning or carry a handheld fan. Use a soap that won't dry your skin and doesn't have fragrances or dyes. The bottom line. Heat rash causes minor discomfort, spots, itching, and swelling. It usually resolves itself in a matter of days for most people. There are several types that look slightly different than one another. You can prevent it by staying cool in warmer climates, wearing loose clothing, and avoiding thick creams. Talk with your doctor if you believe you may have something more serious or if you have a heat rash that frequently recurs. What is Kawasaki disease? Symptoms, causes and risk factors, diagnosis, treatment, complications, outlook, takeaway, a rare but serious illness. Kawasaki disease, KD, or mucocutaneous lymph node syndrome, is an illness that causes inflammation in arteries, veins, and capillaries. It also affects your lymph nodes and causes symptoms in your nose, mouth, and throat. It's the most common cause of heart disease in children. The Kawasaki Disease Foundation, KDF, estimates that KD affects more than 4,200 children in the United States each year. KD is also more common in boys than in girls and in children of Asian and Pacific Island descent. However, KD can affect children and teenagers of all racial and ethnic backgrounds. In most cases, children will recover within a few days of treatment without any serious problems. Recurrences are uncommon. If left untreated, KD can lead to serious heart disease. Read on to learn more about KD and how to treat this condition. What are the symptoms of Kawasaki disease? Kawasaki disease occurs in stages with telltale symptoms and signs. The condition tends to appear during late winter and spring. In some Asian countries, cases of KD peak during the middle of summer. Early stages. Early symptoms, which can last up to 2 weeks, may include high fever that persists for 5 or more days, rash on the torso and groin, bloodshot eyes, without crusting, bright red, swollen lips, strawberry tongue, which appears shiny and bright with red spots, swollen lymph nodes, swollen hands and feet, red palms and soles of the feet. Heart problems may also appear during this time. Late stages. Later symptoms begin within 2 weeks of the fever. The skin on the hands and feet of your child may start to peel and come off in sheets. Some children may also develop temporary arthritis or joint pain. Other signs and symptoms include abdominal pain, vomiting, diarrhea, enlarged gallbladder, temporary hearing loss. Call your doctor if your child is showing any of these symptoms. Children who are younger than 1 or older than 5 are more likely to present incomplete symptoms. These children make up the 25% of KD cases that are at a heightened risk of experiencing heart disease complications. What causes Kawasaki disease? The exact cause of Kawasaki disease is still unknown. Researchers speculate that a mixture of genetics and environmental factors can cause KD. This may be due to the fact that KD occurs during specific seasons and tends to affect children of Asian descent. Risk factors. Kawasaki disease is most common in children, particularly those of Asian descent. About 75% of KD cases are children under the age of 5, according to the KDF. Researchers don't believe that you can inherit the disease, but the risk factors tend to increase within families. Siblings of someone who has KD are 10 times more likely to have the disease. How is Kawasaki disease diagnosed? There is no specific test for Kawasaki disease. A pediatrician will take into account the child's symptoms and rule out illnesses with similar symptoms, such as scarlet fever, a bacterial infection that causes fever, chills, and sore throat; juvenile rheumatoid arthritis, a chronic disease that causes joint pain and inflammation; measles; toxic shock syndrome; idiopathic juvenile arthritis; juvenile mercury poisoning; medical reaction; Rocky Mountain spotted fever, a tick-borne illness. A pediatrician might order additional tests to check how the disease has affected the heart. These may include echocardiograph. An echocardiograph is a painless procedure that uses sound waves to create pictures of the heart and its arteries. This test may need to be repeated to show how Kawasaki disease has affected the heart over time. Blood tests. Blood tests may be ordered to rule out other illnesses. In KD, there may be an elevated white blood cell count, low red blood cell count, and inflammation. Chest X-ray. A chest X-ray creates black and white images of the heart and lungs. A doctor may order this test to look for signs of heart failure and inflammation. Electrocardiogram. An electrocardiogram, or ECG, records the electrical activity of the heart. Irregularities in the ECG may indicate that the heart has been affected by KD. Kawasaki disease should be considered a possibility in any infant or child who has a fever lasting more than 5 days. This is especially the case if they're showing other classic symptoms of the disease like peeling skin. How is Kawasaki disease treated? Children diagnosed with KD should begin treatment immediately to prevent heart damage. First-line treatment for KD involves an infusion of antibodies, intravenous immunoglobulin, over 12 hours within 10 days of the fever and a daily dosage of aspirin over the next 4 days. The child may need to continue to take lower doses of aspirin for 6 to 8 weeks after the fever goes away to prevent the formation of blood clots. One study also found that the addition of prednisolone significantly reduced potential heart damage, but this has yet to be tested in other populations. Timing is critical for preventing serious heart problems. Studies also report a higher rate of resistance to treatment when it's given before the 5th day of the fever. About 11 to 23% of children with KD will have a resistance. Some children may require longer treatment time to prevent a blocked artery or a heart attack. In these cases, treatment involves daily antiplatelet aspirin doses until they have a normal echocardiograph. It may take 6 to 8 weeks for coronary artery abnormalities to reverse. What are the possible complications of Kawasaki disease? KD leads to serious heart problems in about 25% of the children who have the disease. Untreated KD can increase your risk for a heart attack and cause myocarditis, or inflammation of the heart muscle, dysrhythmia, or an abnormal heart rhythm, aneurysm or weakening and bulging of the artery wall. Treatment for this stage of the condition requires long-term dosing of aspirin. Patients may also need to take blood thinners or undergo procedures such as coronary angioplasty, coronary artery stenting, or coronary artery bypass. Children who develop coronary artery problems due to KD should take care to avoid lifestyle factors that can increase their risk for a heart attack. These factors include being obese or overweight, having high cholesterol, and smoking. What's the long-term outlook for Kawasaki disease? There are 4 possible outcomes for someone with KD. You make a full recovery without heart problems, which requires early diagnosis and treatment. You develop coronary artery problems. In 60% of these cases, patients are able to reduce these concerns within a year. You experience long-term heart problems, which requires long-term treatment. You have a reoccurrence of KD, which happens in only 3% of cases. KD has a positive outcome when diagnosed and treated early. With treatment, only 3 to 5% of KD cases develop with coronary artery problems. Aneurysms develop in 1%. Children who have had Kawasaki disease should receive an echocardiogram every 1 or 2 years to screen for heart problems. The takeaway: KD is a disease that causes inflammation in your body, mainly the blood vessels and lymph nodes. It mainly affects children under the age of 5, but anyone can contract KD. The symptoms are similar to a fever, but they show up in 2 distinct stages. A persistent, high fever that lasts for more than 5 days, a strawberry tongue, and swollen hands and feet are a few of the symptoms of the early stage. In the later stage, symptoms may include joint pain, skin peeling, and abdominal pain. Talk to your doctor if your child shows any of these symptoms. In some children, the symptoms may appear incomplete, but KD can cause serious heart problems if left untreated. About 25% of the cases that do develop into heart disease are due to misdiagnosis and delayed treatment. There's no specific diagnostic test for KD. Your doctor will look at your children's symptoms and perform tests to rule out other conditions. Timely treatment can significantly improve the outcome for children with KD. Question: I had Kawasaki disease when I was younger. The only question that was left unanswered was, can it affect my immune system today? I get sick a lot, and if anything is going around, am I sure to get it? Morgan, Healthline reader. A. Kawasaki disease is thought to be caused by genetic factors and/or an abnormal immune response to a viral infection, but those theories have yet to be proven. There is no strong evidence that Kawasaki disease causes long-term problems with your body's immune system. Your tendency to easily contract common illnesses is probably related to your genetically determined immune response and not to the fact that you had Kawasaki disease as a child. Graham Rogers, MD. Answers represent the opinions of our medical experts. All content is strictly informational and should not be considered medical advice. Types of heart disease in children and teens: CHD, atherosclerosis, arrhythmias, Kawasaki disease, heart murmurs, pericarditis, rheumatic heart disease, infections. FAQs. Summary: different types of heart disease can affect children and teens. Some may be present at birth, while others may develop due to infections and other factors. Many different types of heart problems can affect children and teens. They can include congenital heart defects, infections that affect the heart disease acquired in childhood due to illnesses or genetic syndromes. The good news is that with treatment, many children and teens with heart disease go on to live active, full lives. We'll cover the types of heart disease that typically affect children and teens and how doctors treat them. Congenital heart disease. Congenital heart disease, CHD, is a type of heart disease you are born with. It occurs due to heart defects that are present at birth. In the US, an estimated 1% trusted source of babies born each year have CHD. CHDs that affect children and teens can include heart valve disorders like a narrowing of the aortic valve, which restricts blood flow. Hypoplastic left heart syndrome, where the left side of the heart is underdeveloped. Disorders involving holes in the heart, typically in the walls between the chambers and between major blood vessels leaving the heart, including ventricular septal defects, atrial septal defects, patent ductus arteriosus, tetralogy of Fallot, which is a combination of 4 defects, including a hole in the ventricular septum, a narrowed passage between the right ventricle and pulmonary artery, a thickened right side of the heart, a displaced aorta. Congenital heart defects may have long-term effects on your health. They're usually treated with surgery, catheter procedures, medications, and in severe cases, heart transplants. Some people with CHDs will require lifelong monitoring and treatment. Atherosclerosis. Atherosclerosis occurs when fat and cholesterol-filled plaques build up inside arteries. As the buildup increases, arteries become stiffened and narrowed, which increases the risk of blood clots and heart attacks. It typically takes many years for atherosclerosis to develop. While it is not common for children or teenagers to experience symptoms from it, some evidence suggests trusted source that the disease may begin in childhood. Some health issues and other factors may increase the risk. These can include overweight/obesity, type 1 and type 2 diabetes, hypertension, genetic factors, metabolic syndrome. Doctors screen all children for high cholesterol and high blood pressure. Doctors may screen children with certain risk factors earlier. Treatment typically involves lifestyle changes like increased exercise and dietary modifications. Arrhythmias. An arrhythmia is an abnormal rhythm of the heart. It can cause the heart to pump less efficiently. Many different types of arrhythmias may occur in children, including a fast heart rate, tachycardia, the most common type found in children being supraventricular tachycardia, a slow heart rate, bradycardia, long QT syndrome, LQTS, Wolff-Parkinson-White syndrome, WPW syndrome. Symptoms may include weakness, fatigue, dizziness, fainting, difficulty feeding. Treatments depend on the type of arrhythmia and how it affects the child's health. Kawasaki disease. Kawasaki disease is a rare disease primarily affecting children under 5 years old. Trusted source. It can cause inflammation in the blood vessels in the heart arteries, hands, feet, mouth, lips, throat. It also produces a fever and swelling in the lymph nodes. Researchers aren't sure yet what causes it. Treatment depends on the extent of the disease but often involves prompt treatment with intravenous gamma globulin, aspirin if recommended by a doctor, corticosteroids, which may reduce future complications. Children with Kawasaki disease often require lifelong follow-up appointments to monitor their heart health. Aspirin use in children. While doctors may use aspirin to treat certain health conditions in children, using it at home as a fever reducer can be dangerous. In children with a viral infection, aspirin can cause Reye syndrome, a rare disorder that causes brain and liver damage. Was this helpful? Heart murmurs. A heart murmur is a sound made by blood circulating through the heart's chambers or valves, or through blood vessels near the heart. Often it's harmless. Other times it may signal an underlying cardiovascular problem. Heart murmurs may develop due to CHDs, fever, anemia. If a doctor hears an abnormal heart murmur in a child, they'll perform additional tests on the heart. Innocent heart murmurs usually resolve by themselves, but if the heart murmur is caused by a problem with the heart, it may require additional treatment. Pericarditis. This condition occurs when the thin sac or membrane that surrounds the heart, pericardium, becomes inflamed or infected. The amount of fluid between its 2 layers increases, impairing the heart's ability to pump blood the way it should. Pericarditis has a few different causes. These can include surgery to repair a CHD, bacterial infections, viral infections, or fungal infections. Autoimmune diseases like lupus. Treatments depend on the severity of the disease, age, and overall health. Understanding the risks and complications of giant cell arteritis, blindness, aortic aneurysm, stroke, heart attack, peripheral artery disease, polymyalgia rheumatica. Takeaway: giant cell arteritis, GCA, inflames the lining of your arteries. Most often, it affects arteries in your head, causing symptoms like head and jaw pain. It used to be called temporal arteritis because it can cause inflammation in the arteries in the temples. Swelling in the blood vessels reduces the amount of blood that can flow through them. All of your tissues and organs rely on oxygen-rich blood to function properly. A lack of oxygen can damage these structures. Treatment with high doses of corticosteroid medications like prednisone brings down inflammation in the blood vessels quickly. The earlier you start taking this medication, the less likely you'll develop complications like the following. Blindness. Blindness is one of the most serious and worrisome complications of GCA. When there isn't enough blood flow into the artery that sends blood to the eye, the tissue that the artery feeds starts to die. Eventually, a lack of blood flow to the eyes can cause blindness. Often, only one eye is affected. Some people lose sight in the second eye at the same time, or a few days later if they don't get treated. The vision loss can happen very suddenly. There's usually no pain or other symptoms to warn you. Once you lose vision, you can't get it back. That's why it's important to see an eye doctor or rheumatologist and get on treatment, which usually involves taking a steroid medication first. If you have any changes in your vision, alert your doctors right away. Aortic aneurysm. Although GCA is rare overall, it's one of the main causes of aortic aneurysm. The aorta is your body's main blood vessel. It runs down the middle of your chest, carrying blood from your heart to the rest of your body. An aneurysm is a bulge in the wall of the aorta. It happens when your aorta wall is weaker than usual. If an aneurysm bursts, it can cause dangerous internal bleeding and death if emergency treatment is not given. Aortic aneurysms don't usually cause symptoms. Once you've been diagnosed with GCA, your doctor may monitor you for aneurysms in the aorta and other large blood vessels with imaging tests like ultrasound, MRI, or CT scans. If you get an aneurysm and it's large, doctors can repair it with surgery. The most common procedure inserts a man-made graft into the aneurysm site. The graft strengthens the weakened area of the aorta to prevent it from rupturing. Stroke. GCA increases your risk of an ischemic stroke, although this complication is rare. An ischemic stroke happens when a clot blocks the flow of blood to the brain. A stroke is life-threatening and needs prompt treatment in a hospital, preferably one with a stroke center. People who have a stroke are more likely to have GCA symptoms like jaw pain, short-term vision loss, and double vision. If you have symptoms like these, let your doctor know about them right away. Heart attack. People with GCA are also at a slightly higher risk of a heart attack. It's not clear whether GCA itself causes heart attacks, or if the two conditions share the same risk factors, particularly the inflammation. A heart attack happens when an artery that supplies your heart with blood becomes blocked. Without enough blood, sections of the heart muscle begin to die. Getting quick medical care for a heart attack is important. Watch out for symptoms like pressure or tightness in your chest, pain or pressure that radiates to your jaw, shoulders, or left arm, nausea, shortness of breath, cold sweat, dizziness, tiredness. If you have these symptoms, call 911 or go to a hospital emergency room right away. Peripheral artery disease. People with GCA are also at a slightly higher risk of peripheral artery disease, PAD. PAD reduces blood flow to the arms and legs, which can cause cramping, numbness, weakness, and cold extremities. Similar to heart attacks, it's not clear whether GCA causes PAD, or if the two conditions share common risk factors. Polymyalgia rheumatica. Polymyalgia rheumatica, PMR, causes pain, muscle weakness, and stiffness in the neck, shoulders, hips, and thighs. It isn't a complication of GCA, but the two diseases often occur together. About half of people with GCA also have PMR. Corticosteroid drugs are the main treatment for both conditions. In PMR, prednisone and other drugs in this class help to relieve stiffness and bring down inflammation. Lower doses of prednisone can be used in PMR than in GCA. Takeaway: GCA can cause several complications. One of the most serious and concerning is blindness. Once you lose vision, you can't get it back. Heart attack and stroke are rare, but they can happen in a small percentage of people with GCA. Early treatment with corticosteroids can protect your vision and help prevent other complications of this disease. What is unstable angina? Angina is another word for heart-related chest pain. You may also feel pain in other parts of your body, such as shoulders, neck, back, arms. The pain is due to inadequate blood supply to your heart muscle, which deprives your heart of oxygen. There are two types of angina, stable and unstable. Stable angina occurs predictably. It happens when you exert yourself physically or feel considerable stress. Stable angina doesn't typically change in frequency and it doesn't worsen over time. Unstable angina is chest pain that occurs at rest or with exertion or stress. The pain worsens in frequency and severity. Unstable angina means that blockages in the arteries supplying your heart with blood and oxygen have reached a critical level. An attack of unstable angina is an emergency and you should seek immediate medical treatment. If left untreated, unstable angina can lead to heart attack, heart failure, or arrhythmias, irregular heart rhythms. These can be life-threatening conditions. What causes unstable angina? The principal cause of unstable angina is coronary heart disease caused by a buildup of plaque along the walls of your arteries. The plaque causes your arteries to narrow and become rigid. This reduces the blood flow to your heart muscle. When the heart muscle doesn't have enough blood and oxygen, you feel chest pain. Who is at risk for unstable angina? Risk factors for coronary heart disease include diabetes, obesity, a family history of heart disease, high blood pressure, high low-density lipoprotein, LDL, cholesterol, low high-density lipoprotein, HDL, cholesterol, being male, using any form of tobacco, leading a sedentary lifestyle. Men 45 years and older and women 55 years and older are more likely to experience unstable angina. What are the symptoms of unstable angina? The main symptom of angina is chest discomfort or pain. The sensation can vary depending on the person. Angina symptoms include chest pain that feels crushing, pressure-like, squeezing, or sharp. Pain that radiates to your upper extremities, usually on the left side or back. Nausea, anxiety, sweating, shortness of breath, dizziness, unexplained fatigue. It's possible for stable angina to progress to unstable angina. If you have stable angina, be aware of any chest pains you feel even when at rest. Also watch for chest pains that last longer than they typically do or that simply feel different to you. If you take nitroglycerin, a medication that enhances blood flow, for relief during a stable angina attack, you may find the medicine doesn't work during an unstable angina attack. How is unstable angina diagnosed? Your doctor will perform a physical exam that includes checking your blood pressure. They may use other tests to confirm unstable angina, such as blood tests to check for creatine kinase and cardiac biomarkers, troponin, that leak from your heart muscle if it's been damaged. Electrocardiogram, to see patterns in your heartbeats that may indicate reduced blood flow. Echocardiography, to produce images of your heart that reveal evidence of blood flow problems. Stress tests, to cause your heart to work harder and make angina easier to detect. Computed tomography angiography, coronary angiography and heart catheterization, to study the health and caliber of your arteries. Because coronary angiography helps your doctor visualize any artery narrowing and blockages, it's one of the most common tests they use to diagnose unstable angina. How is unstable angina treated? Treatment for unstable angina depends on the severity of your condition. Medication. One of the first treatments your doctor may recommend is a blood thinner, such as aspirin, heparin, or clopidogrel. When your blood isn't as thick, it can flow more freely through your arteries. May use other medications to reduce angina symptoms, including drugs that reduce blood pressure, cholesterol levels, anxiety, arrhythmia symptoms. Surgery. If you have a blockage or severe narrowing in an artery, your doctor may recommend more invasive procedures. These include angioplasty, where they open up an artery that was previously blocked. Your doctor also may insert a small tube known as a stent to keep your artery open. In severe instances, you may need heart bypass surgery. This procedure reroutes blood flow away from a blocked artery to help improve blood flow to your heart. Lifestyle changes. No matter the severity of your condition, you may need to change your long-term lifestyle. Lifestyle changes that can improve your heart health include eating a healthier diet, lowering your stress, exercising more, losing weight if you are overweight, Quitting smoking if you currently smoke. All of these changes can lessen your chance of an angina attack and reduce your risk of heart attack. Talk to your doctor about appropriate changes to your lifestyle, including a healthy diet and exercise routine. The best apps of the year for quitting smoking. How can I prevent unstable angina? Non-medical self-care options include taking steps to lose weight, giving up tobacco use, and exercising more regularly. Working toward a healthier lifestyle can improve your heart health and reduce your risk of future unstable angina episodes. All about angina. Angina attack. Types. In women. Diagnosis. Treatment. Life expectancy. When to see a doctor. Takeaway. Angina is pain that you feel in your chest. It happens when your heart isn't getting enough blood. There are several different types of angina. They're classified based on their cause, pattern of symptoms, and severity. Angina itself can be a symptom of an underlying heart condition, such as blockages in the blood vessels around the heart, coronary atherosclerosis, or heart failure. Can you die from angina? No, because angina is a symptom, not a disease or condition. However, this symptom is a sign of coronary artery disease, which means you may be at increased risk of a heart attack, and heart attacks can be life-threatening. Continue reading to learn more about angina, how it's treated, and when you should see a doctor. What is an angina attack? The general symptoms of angina can include chest pain or discomfort that usually starts behind the breastbone or in the chest and may feel like squeezing, tightness, heaviness, pressure, or burning. Pain or discomfort that can also occur in your arms, back, neck, jaw, shoulder. Feelings of weakness or fatigue, sweating, shortness of breath, nausea or feeling sick to your stomach, being lightheaded or fainting. Are there different types? There are a few different types of angina. Each type has its own defining characteristics. Stable angina. This type follows a consistent pattern, often occurring after exertion or stress. Symptoms typically don't last long and can be relieved using medication or with rest. Unstable angina. Unstable angina doesn't follow a pattern and can also be more severe. It can occur at rest, last longer, and may not be relieved with medications. Since it can progress to a heart attack, it's considered a medical emergency. Microvascular angina. Microvascular angina affects the very small arteries in the heart. It can occur while you're performing your normal day-to-day activities, last a longer time, and cause severe pain. Medication may not ease symptoms. This type of angina may be more common in women. Variant, Prinzmetal's, angina. This type of angina is rare and can occur while you're resting or sleeping. It's caused by a sudden spasm of the arteries in your heart and can cause severe pain. Symptoms can often be relieved with medication, but in some cases the spasm of the arteries can lead to potentially life-threatening arrhythmias or damage to the heart muscle. Is it different in women? Angina may be different in women than in men, as women can experience the symptoms of classic angina differently. For some women, they may not feel the classic symptoms of chest pressure or tightness, but can just feel fatigued as a symptom of angina. Women may also more frequently trusted source have coronary microvascular disease. Coronary microvascular disease involves blockages in the tiny arteries in the heart, which can affect blood flow. It's different than coronary artery disease, where plaque buildup and restricts blood flow. In fact, up to 50% trusted source of women with angina symptoms don't have a blocked epicardial, major, coronary artery, according to the American Heart Association. Women that have coronary microvascular disease often experience microvascular angina, which can occur during normal activities as well as with physical or mental stress. What causes it? Biologically speaking, angina can be caused by a variety of things. Coronary artery disease. When a substance called plaque builds up on the walls of the heart's arteries, causing them to narrow. Coronary microvascular disease. When the small arteries of the heart become damaged, reducing the flow of blood. Spasms. A sudden spasm of the arteries around the heart can cause them to limiting blood flow. Blood clots. In cases of unstable angina/myocardial infarction, a blood clot can form in the arteries around the heart that partially or completely blocks the blood flow in an artery, causing angina symptoms and possibly a heart attack, if there is damage to the heart. There are also several risk factors that can trigger angina symptoms due to a mismatch between the oxygen supply to the heart and the oxygen demand of the heart. Often these are situations where the heart requires an additional oxygen supply. They can include physical exertion. Mental or emotional stress. Eating a heavy meal. Very cold or hot temperatures. Smoking. How is it diagnosed? In order to diagnose angina, your doctor will do the following. Take your medical history. Your doctor will ask about your symptoms, including what they feel like, how long you've had them, and when they occur. They'll also ask if you have a family history of heart disease or any risk factors for heart disease. Doing a physical examination. This can include things like listening to your heart, measuring your heart rate, and taking your blood pressure. Performing diagnostic tests. There are many possible tests that your doctor may use to help diagnose angina. They can include blood tests. Blood tests can measure certain proteins that are released during a heart attack. Cholesterol and lipid levels may also be measured. Chest X-ray. A chest X-ray can help rule out a lung or bony condition that may be causing your symptoms. Electrocardiogram (ECG). ECGs measure the electrical impulses generated when your heart beats. Certain ECG patterns can indicate disrupted blood flow. Stress test. A stress test evaluates how your heart functions during exercise. Other tests like ECG and echocardiogram or nuclear imaging may also be used during a stress test. Echocardiogram. This test generates images of your heart using sound waves. It can help your doctor see if there is a problem with the squeezing or relaxing function of the heart or with the heart valves. Coronary angiography. This test uses X-rays and a special dye to help the doctor see if a blocked or partially blocked artery is causing your symptoms. It can also be used to treat the blockage, if appropriate. Coronary CT angiography. This procedure uses a CT scan to help determine if your arteries have narrowed. Stress MRI. This test uses an MRI scan to generate detailed images of your heart and its blood vessels when they are under stress. What are the treatments? There are many treatment options available for angina. Your doctor will work with you to develop a treatment plan that's appropriate for your condition. Medications. Several different medications can be given for angina. Which one you're prescribed can depend on the type of angina that you have. Angina medications can help to relieve symptoms of a flare-up or help to prevent a flare-up from occurring. Possible angina medications include nitrates, such as nitroglycerin, that can help blood vessels to relax and widen. Beta blockers, which cause the heart to beat more slowly and less forcefully, reducing oxygen demand. Calcium channel blockers, which help to relax blood vessels. ACE inhibitors that can help to lower blood pressure. Clot-preventing drugs to prevent the formation of blood clots, such as aspirin. Statins to help lower cholesterol levels. Ranolazine, which can help you experience symptoms less frequently. Lifestyle changes. Adopting lifestyle changes can also help limit your angina symptoms. Examples include eating a heart-healthy diet and avoiding large or heavy meals. Exercising regularly, but being sure to pace yourself and take breaks if necessary. Maintaining a healthy weight. Finding effective ways to relieve stress. Quitting smoking, vaping, or marijuana use. Limiting alcohol intake. Avoiding exposure to very hot or cold temperatures. Making sure other health conditions like high blood pressure or diabetes are properly treated. Surgery. In cases where medications and lifestyle changes can't manage your angina, you may require surgery. Additionally, medical emergencies like unstable angina may also require surgical treatment. The type of procedure used will depend on your individual condition. Options include percutaneous coronary intervention, PCI. PCI uses a small balloon to help open or widen an artery. A stent is then put in place to help keep the artery open. This is done during a coronary angiogram. Coronary bypass. This procedure uses a blood vessel from somewhere else in the body, usually a vein in your leg or artery in your chest, to help bypass an artery in the heart that's been blocked. How long can you live? Angina can be an indicator of other underlying heart conditions. It can mean that you're at an increased risk of experiencing a potentially life-threatening event like a heart attack or problems with other blood vessels, such as those going to the brain, stroke, or those going to the legs, peripheral arterial disease. If you have angina, it's very important that you get treatment. If your angina is properly managed through things like medications and lifestyle changes, you can lead a very normal life. After being diagnosed with angina, you may have to follow up with your doctor several times a year. This is very important to make sure that the treatment you're receiving is effectively managing your condition. Outlook can vary by individual. It may depend on several factors, including your overall health, your lifestyle, and if you have any other underlying health conditions. When to see a doctor. It's always important to see your doctor if you experience chest pain. They can help you figure out what may be causing it and determine an appropriate treatment. If chest pain comes on suddenly, is severe, or lasts longer than a few minutes, you should seek emergency medical attention. These could be signs of a heart attack. If you have angina and notice your symptoms have changed, occur at rest, or don't respond to medications, you should also seek emergency treatment. Unstable angina can progress to a heart attack. The bottom line. Angina is chest pain that happens when your heart isn't getting sufficient blood. It's often caused by conditions like coronary artery disease or coronary microvascular disease. Things like physical exertion and stress can trigger symptoms, and risk factors include smoking, family history, high cholesterol, high blood pressure, or diabetes. Experiencing angina is a warning sign that you could be at an increased risk of having a heart attack or stroke. Additionally, unstable angina can develop into a heart attack if you don't receive prompt treatment. If you experience new chest pain, be sure to make an immediate appointment with your doctor to discuss it. Any chest pain that's severe, sudden, or lasts more than a few minutes should be treated as a medical emergency. Impetigo, everything you need to know. Symptoms. Pictures. Causes and risk factors. Diagnosis. Treatment. Complications. Is it contagious? Summary. Impetigo is a bacterial infection that affects your skin, causing sores and blisters. It can appear differently depending on the stage of infection and what part of your body it affects. Impetigo is a common contagious skin infection. Bacteria like Staphylococcus aureus or Streptococcus pyogenes infect the outer layers of your skin, called the epidermis. Your face, arms, and legs are most often affected. Anyone can get impetigo, but it most commonly affects children, especially those who are 2 to 5 years old. Trusted source. The infection often begins in minor cuts, insect bites, or a rash such as eczema, any place where your skin is broken. But it can also occur on healthy skin. Impetigo symptoms. The first symptoms of impetigo are discolored sores on your skin, often clustered around your nose and lips. These often appear pink or red on light skin and dark red, purple, brown, or gray on darker skin tones. These sores quickly grow into blisters that may ooze, burst, and then form a yellowish crust. The clusters of blisters may expand to cover more of your skin. The sores can be itchy and occasionally painful. After the crust phase, they form discolored marks that fade without leaving scars. Impetigo types. There are 3 types of impetigo based on the bacteria that cause them and the sores that form. Each type goes through a series of stages. Non-bullous, this is the most common form of impetigo and causes patches of skin discoloration and sores that can break and crust over. Bullous, bullous means blister. This form of impetigo forms large, fluid-filled blisters that can burst open. Crusts then form at the open sores. Ecthyma, this is a more severe but less common form. Ecthyma impetigo affects deeper layers of your skin and can cause large, painful blisters that break into sores. These sores crust over and may leave scars. Impetigo and other skin conditions. Impetigo can cause similar symptoms to other skin conditions. People may mistake impetigo for cold sores, ringworm, erysipelas, eczema. Pictures of impetigo. Because impetigo can occur on any part of your skin, it may take on a slightly different appearance for different people. It will also look different depending on the stage of your infection. Below are example pictures of impetigo on a variety of skin tones. Warning: contains sensitive content. What causes impetigo? Strains of Staphylococcus, staph, or Streptococcus, strep, bacteria cause impetigo. These bacteria can get into your body through a break in your skin from a cut, scratch, insect bite, or rash. The disease can be contagious. You can contract these bacteria if you touch the sores of a person with impetigo or if you touch items like towels, clothes, or sheets that the person used. Who's at risk of impetigo? While anyone can contract impetigo, close contact with someone with the infection is the most common risk factor. Trusted source for the disease. Impetigo spreads more easily when people are in close quarters. Adults and children are at higher risk of impetigo if they live in a warm, humid climate, have diabetes, have a compromised immune system, such as from HIV or AIDS, have skin conditions such as eczema, dermatitis, or psoriasis, have a sunburn or other burns, have itchy infections, such as lice, scabies, herpes simplex, or chickenpox, have insect bites or poison ivy, play contact sports, Age is also a significant risk factor for impetigo. The more common non-bullous variety is seen most often in children 2 to 5 years old. Trusted source. The less common bullous variety occurs in children younger than 2 years old in 90% trusted source of people with it. When impetigo does occur in adults, it's more common in people assigned male at birth. Diagnosing impetigo. It's a good idea to see a doctor or other healthcare professional if you suspect impetigo. They can usually diagnose the infection by its appearance. If your sores don't clear up with treatment, a doctor may want to culture the bacteria. This involves taking a little bit of the liquid from your sore and testing it to see what type of bacteria caused it to determine which antibiotics will work best against it. Treatment of impetigo. Antibiotics are the first line of treatment for impetigo. The type of antibiotic you get depends on how widespread or severe your lesions are. If you have impetigo in only a small area of your skin, topical antibiotic creams, gels, or ointments are the preferred treatment. Options include mupirocin cream or ointment, Bactroban or Centeni, and retapamulin ointment, Altobax. If your impetigo is severe or widespread, a doctor can prescribe oral antibiotics such as amoxicillin/clavulanate, Augmentin, cephalosporins, clindamycin, Cleocin. Home treatment. With treatment, impetigo usually heals in 7 to 10 days. If you have an underlying infection or skin disease, the infection may take longer to heal. Trusted source. A number of home remedies are also available at your drugstore or natural products store. Keeping the area clean and covering it with bandages if possible can stop it from spreading. Learn more about home remedies for impetigo here. Essential oils. Some people claim that various essential oils can help to remedy impetigo. Trusted source, including geranium oil, patchouli oil, tea tree oil. Before you try any essential oil or other alternative treatment, speak with a doctor. Some of these products can cause side effects, and they may not be safe for everyone. A note on the effectiveness of essential oils. While research suggests there are health benefits, the Food and Drug Administration, FDA, doesn't monitor or regulate the purity or quality of essential oils. It's important to talk with a healthcare professional before you begin using essential oils and be sure to research the quality of a brand's products. Always do a patch test before trying a new essential oil. Was this helpful? Prevention. If the lesions can't be reliably covered, children with impetigo should stay home until they no longer have an active infection that can be passed to others. Adults who work in jobs that involve close contact with others should ask their doctor when it's safe for them to return to work. Good hygiene is the best way to prevent impetigo. Follow these tips. Bathe and wash your hands often to cut down on skin bacteria. Cover any skin wounds or insect bites to protect the area. Keep your nails clipped and clean. Don't touch or scratch open sores. This can spread the infection. Wash everything that comes into contact with the impetigo sores in hot water and laundry bleach. Potential complications from impetigo. The bacteria responsible for impetigo can cause complications, including other more serious infections and harmful immune responses. Staphylococcal scalded skin syndrome, staph infections can trigger the release of certain toxins around the infection. If the toxins spread, it can lead to staphylococcal scalded skin syndrome. Soft tissue infection. The bacteria that cause impetigo can cause other infections, including necrotizing fasciitis. Skin or soft tissue infections that spread rapidly are an emergency and require immediate medical assistance. Call 911 or local emergency services if you experience this. Toxic shock syndrome. The same bacteria that cause impetigo can also cause toxic shock syndrome. It's a potentially life-threatening condition that needs medical attention. Call 911 or local emergency services if you experience fever, low blood pressure, and rapid heart rate. Rheumatic fever. Your immune system may respond to impetigo with inflammation through rheumatic fever. This isn't contagious, but it requires immediate treatment. Call 911 or local emergency services if you suspect you have a rheumatic fever. Impetigo in adults. Adults have a higher risk of complications than children. These complications may include acute post-streptococcal glomerulonephritis, cellulitis, lymphangitis, sepsis. Is impetigo contagious? The open sores are highly contagious. Scratching the sores can spread the infection from one place on your skin to another or to another person. The infection can also spread from anything touched by a person with an impetigo infection. Hygiene is key to controlling impetigo spread. If you or your child has impetigo, wash and disinfect everything the infection might have come into contact with, including clothes, bedding, towels, toys, sports equipment. Takeaway. Impetigo is a highly contagious bacterial skin infection that generally isn't serious. It clears up faster with antibiotics and requires good hygiene to prevent it from spreading. If you suspect that you or a loved one has impetigo, contact a doctor for diagnosis. Bacitracin versus Neosporin, which is better for me? Active ingredients. Drug action. Side effects. Dosage. Warnings. Takeaway. Sources. Introduction. Cutting your finger, scraping your toe, or burning your arm doesn't just hurt. These minor injuries can turn into bigger problems if they become infected. You may turn to an over-the-counter, or OTC, product to help. Bacitracin and Neosporin are both OTC topical antibiotics used as first aid to help prevent infection from minor abrasions, wounds, and burns. These drugs are used in similar ways, but they contain different active ingredients. One product may be better than the other for some people. Compare the major similarities and differences between bacitracin and Neosporin to decide which antibiotic may be better for you. Active ingredients and allergies. Bacitracin and Neosporin are both available in ointment forms. Bacitracin is a brand name drug that contains the active ingredient bacitracin only. Neosporin is the brand name of a combination drug with the active ingredients bacitracin, neomycin, and polymyxin B. Other Neosporin products are available, but they contain different active ingredients. One of the main differences between the two drugs is that some people are allergic to Neosporin but not to bacitracin. For instance, neomycin, an ingredient in Neosporin, has a higher risk of causing allergic reactions than other ingredients in either drug. Still, Neosporin is safe and works well for most people, like bacitracin. It's especially important with over-the-counter products to read the ingredients. Many of these products may have the same or similar brand names but different active ingredients. If you have questions about the ingredients in an over-the-counter product, it's better to ask your pharmacist than to guess. What they do. The active ingredients in both products are antibiotics, so they help prevent infection from minor injuries. These include scratches, cuts, scrapes, and burns to the skin. If your wounds are deep or more severe than minor scratches, cuts, scrapes, and burns, talk to your doctor before using either product. The antibiotic in bacitracin stops bacterial growth, while the antibiotics in Neosporin stop bacterial growth and also kill existing bacteria. Neosporin can also fight against a wider range of bacteria than bacitracin can. Active ingredients: bacitracin, Neosporin, bacitracin XX, neomycin X, polymyxin BX. Side effects, interactions, and warnings. Most people tolerate both bacitracin and Neosporin well, but a small number of people will be allergic to either drug. An allergic reaction can cause a rash or itching. In rare cases, both drugs can cause a more serious allergic reaction. This can cause trouble breathing or swallowing. Neosporin can cause redness and swelling at the wound site. If you notice this and aren't sure if it's an allergic reaction, stop using the product and call your doctor right away. If you think your symptoms are life-threatening, stop using the product and call 911. However, these products don't typically cause side effects. Mild side effects, serious side effects. Itchiness, trouble breathing. Rash, trouble swallowing. Hives. There are also no known significant drug interactions for either bacitracin or Neosporin. Still, you should use the drugs only according to the directions on the package. Using the ointments. How long you use the product depends on the type of wound you have. You can ask your doctor how long you should use bacitracin or Neosporin. Do not use either product for longer than 7 days unless your doctor tells you to. You use bacitracin and Neosporin in the same way. First, clean the affected area of your skin with soap and water. Then, apply a small amount of the product, about the size of the tip of your finger, on the affected area 1 to 3 times per day. You should cover the injured area with a light gauze dressing or sterile bandage to keep dirt and germs out. When to call a doctor. If your wound doesn't heal after using either drug for 7 days, stop using it and contact your doctor. Tell your doctor if your abrasion or burn gets worse or if it cleared up but returned within a few days. Also call your doctor if you develop a rash or other allergic reaction, such as trouble breathing or swallowing. Have ringing in your ears or trouble hearing. Key differences. Bacitracin and Neosporin are safe antibiotics for most people's minor skin wounds. A few key differences may help you choose one over the other. Neomycin, an ingredient in Neosporin, is linked with a higher risk of allergic reactions. Still, any of the ingredients in these products can cause an allergic reaction. Both Neosporin and bacitracin stop bacterial growth, but Neosporin can also kill existing bacteria. Neosporin can treat more types of bacteria than bacitracin can. Talk to your doctor or pharmacist about your individual treatment's needs. They can help you choose whether neomycin or bacitracin is a better fit for you. The best remedies for itching. Anti-itch creams. Oatmeal. Gels. Moisturizers. Cold packs. Antihistamines. Petroleum jelly. Antidepressants. Stop scratching. Relief. Tips. Takeaway. We include products we think are useful for our readers. If you buy through links on this page, we may earn a small commission. Here's our process. How we vet brands and products. You may be able to stop itching with over-the-counter products or at-home remedies, such as petroleum jelly. What causes itching? Itching, pruritus, can be more than a small annoyance. It can cause a lot of discomfort and may even become a distraction. You may be wondering when itching is serious and how you can cure your itchiness at home. Your skin can itch for a variety of reasons. For example, you may have touched a certain type of plant, like ragweed or poison ivy. Psoriasis and eczema are two types of skin issues that can cause dry skin and itching. Illness, an insect bite, or healing from a burn or cut can also cause you to feel itchy. Read on to learn about the best remedies for itchy skin and when it's time to see your doctor. Anti-itch creams. Featured pick. CeraVe Hydrocortisone Anti-Itch Cream. National Eczema Organization. Amazon rating 4.6. Highlights. Includes hyaluronic acid for moisture. Could be used on eczema flare-ups. Helps restore and protect the skin barrier. Ingredients. Asterisk prices are accurate as of the date of publication. Anti-itch cream is one way to soothe itchy skin. You may consider trying a cream that contains hydrocortisone. This drug inhibits inflammatory responses in the body and can help calm inflamed, itchy skin. If over-the-counter, OTC, versions don't help, your doctor may prescribe a corticosteroid cream to reduce inflammation. By reducing underlying inflammation in certain skin conditions, like eczema, you may be able to find relief from itchiness. Hydrocortisone and corticosteroid creams should be used for the shortest period possible, usually 1 to 2 weeks, and then discontinued. This is because they can lead to side effects, like thinning skin and possible addiction. Hydrocortisone creams should never be applied to your face unless directed by a doctor. Applying topical antihistamines directly to the affected area of skin first may be preferable over oral antihistamines to avoid side effects associated with oral antihistamines. Anti-itch creams may include cortisone 10 and Benadryl topical. Colloidal oatmeal. Featured pick. Shea Organics Colloidal Oatmeal. Amazon rating 4.7. Highlights. 100% pure colloidal oatmeal. Useful in creams, baths, shampoos, and conditioners. Includes vitamin E for anti-inflammatory benefits. Ingredients. Asterisk prices are accurate as of the date of publication. Colloidal oatmeal isn't something you eat for breakfast. This type of oatmeal is made from oats that have been ground into a very fine powder. A natural product used in many soaps and lotions, it can also be added to a cool bath. One 2016 study trusted source found that this product is safe and helps treat itchiness and moisture loss while also helping to improve the skin barrier. A 2020 study trusted source found that adding 1% colloidal oatmeal to a topical cream improved skin. Out of 61 patients, 30 received the 1% colloidal oat eczema cream, while 31 received a standard moisturizer. The study showed that the group that received the 1% colloidal oat cream showed significant improvement in skin barrier function, skin hydration, and skin pH. The group that received the standard moisturizer showed improvement only in hydration. You can find colloidal oatmeal at many pharmacies or make your own by grinding oats into a fine powder. Shop now at Amazon. Leaf gels. Try a plant-based product like aloe vera gel, which can help trusted source skin retain moisture, or cooling menthol trusted source for simple itches caused by sunburns or mosquito bites. Menthol, which produces a cooling effect, is made from the peppermint plant. Topical menthol should be used with caution due to the possibility of it being an irritant to the skin if not diluted. Both of these products can be purchased at most drug stores. High-quality moisturizers. Featured pick. Hers Tidal Wave Moisturizer. Paraben-free. Highlights. Uses: ingredients that absorb quickly. Gentle formula for acne-prone skin. Contains ingredients for hydration and smoothness. Ingredients. Asterisk: prices are accurate as of the date of publication. Good quality moisturizers hold water in the outermost layer of your skin. This can help trusted source your skin feel hydrated and less dry and itchy. Apply to damp skin for better absorbency, like immediately after bathing. There are different moisturizers that help with different causes of skin dryness. Some moisturizers, like those made with beeswax, coconut oil, and mineral oil, work to prevent water loss by creating a barrier. Other moisturizers, like those made with glycerin, can help repair the skin barrier. Before choosing a moisturizer, contact a dermatologist to discuss which option may be best for your skin. Cold packs. One possible solution. Trusted source for immediate itchy skin relief is also a simple one: a cold pack or a bag filled with ice. The key, as you might have noticed, is cold. Avoid exposing the affected area to hot water as much as possible. It will further irritate the itching skin. Oral antihistamines. Featured pick. Allegra 24-hour adult allergy tablets. Amazon rating 4.8. Highlights. Contains fexofenadine, an antihistamine. Provides 24-hour relief. Helps with indoor and outdoor allergies. Ingredients. Asterisk: prices are accurate as of the date of publication. Histamines are chemicals in the body that cause allergy symptoms, including itching. An antihistamine is a common treatment for allergic reactions. But many antihistamine drugs can make you sleepy, so they're best used before bed. Also, oral antihistamines tend to trusted source work best if your itchy skin is caused by allergies. These may not be the best remedies for acute itchiness due to dry skin or other non-allergic causes. Talk with your doctor before using any OTC oral antihistamines, especially if you're currently taking any other medications. Petroleum jelly. Featured pick. Aquaphor healing ointment. Hypoallergenic. Amazon rating 4.8. Highlights. 41% petroleum jelly and other ingredients. Helps create a protective skin barrier. Preservative and fragrance-free. Ingredients. Asterisk: prices are accurate as of the date of publication. If you have extremely dry, cracked skin along with itchiness, you may consider using a petroleum jelly-based product, like Vaseline or Aquaphor. These are even gentle enough to use on your face, including more delicate areas like the eyelids and lips. But you should avoid using petroleum jelly on your face if you have oily skin, as this could lead to breakouts. While petroleum jelly works best on damp skin, you can still reapply these products on dry skin throughout the day as needed. Antidepressants. According to some studies, antidepressants might be able to help trusted source with itching, too. Some of these drugs cause a release of serotonin that can relax the receptors in your body that provoke the itchy feeling. This treatment is typically used in more chronic cases of itching, but more research and evidence are needed. Resist the urge to scratch. When you have an itch, scratching is the natural response. But it won't help the problem. In fact, it may tear up the skin and prevent it from healing. It may even cause infection. Try extra hard not to scratch your skin. Wear comfortable clothes that don't irritate the skin, and keep your fingernails properly trimmed. It may also be helpful to wear cotton gloves at night to help prevent scratching your skin while you sleep. Use fragrance-free lotions only. Unfortunately, your favorite body lotion could be trusted source aggravating your itchy skin due to added fragrances in the product. It's important to read product ingredients carefully and choose products specifically labeled fragrance-free to help prevent further irritation. This is especially important if you have eczema, psoriasis, or rosacea. How to relieve itchy skin. Consider the following steps to help relieve itchy skin quickly, using some of the above remedies. 1. Apply cool treatments. Apply a cold compress or a wet washcloth to small areas of skin that may be itchy due to a rash, bug bite, or burn. You may use this method for 5 to 10 minutes at a time. For a widespread area of skin, you may consider taking a cool bath instead. 2. Take an oatmeal bath for additional relief. For a more severe, widespread rash or to help treat sunburn or hives, you may consider taking an oatmeal bath. Use lukewarm water and slowly add in colloidal oatmeal, stirring it occasionally, so it doesn't stick to the bottom of the tub. Make sure your bathing time doesn't exceed 15 to 20 minutes. 3. Apply moisturizer to damp skin. Follow up any cooling treatment or oatmeal bath immediately with moisturizer. Damp skin will absorb any lotions or emollient creams more effectively. If you're using a medicated ointment, apply this before your moisturizer. 4. Consider combination therapies for chronic itchy skin. Depending on the cause of your itchy skin, you may benefit from using more than one treatment. This may be especially needed in cases of chronic itching. For example, chronic itchiness related to skin conditions like eczema may benefit from colloidal oatmeal baths, topical emollients, and anti-itch creams. Before using a combination of therapies, be sure to talk with your doctor. Tips for relieving itchy skin. Additionally, certain lifestyle changes can also help relieve itchy skin. Consider the following. Wear loose-fitting clothing to avoid trapping moisture in your skin. Wear natural fabrics, like cotton. Avoid extreme changes in temperatures, especially during the summer and winter months. Keep your house cool and humid, respectively. Use lukewarm water while bathing, and avoid hot tubs. Manage stress as much as possible. Stress can increase skin inflammation and itchiness. In addition to using fragrance-free lotions, make sure that your soaps and detergents are fragrance-free, too. Last medically reviewed on December 8, 2021. How we reviewed this article. Sources. History. Our experts continually monitor the health and wellness space, and we update our articles when new information becomes available. Current version. February 1, 2023. Edited by Shannon Ullman. Copy edited by Connor Rice. December 8, 2021. Medically reviewed by Chris Young, DNP, RN, NEBC, NPD. View all history. Share this article. Medically reviewed by Chris Young, DNP, RN, NEBC, NPD, by Christine Cherney, PhD, updated on February 1, 2023. A guide to the confusing world of face acids and which ones to use. The 12 best foods for healthy skin. Using a toner will totally change your skin. The No BS guide to getting natural-looking Botox. Was this article helpful? Yes. No. 25 conditions that cause raised skin bumps, with pictures. Skin disorders. Growths. Infections. Skin cancer. When to seek help. Treatment. Outlook. Raised skin bumps are mostly harmless. They may present in various ways, from skin tags to keloids. Conditions like acne and chickenpox can also cause them. Get medical help if your bumps resemble those caused by MRSA or skin cancer. Raised skin bumps are very common and are harmless in most cases. They can result from several conditions, including infections, allergic reactions, skin disorders, skin cancer. Skin bumps can vary in appearance and number depending on the cause. They may be the same color as your skin or a different color. They may be itchy, large, or small. Some can be hard, while others can feel soft and movable. Most skin bumps do not need treatment. However, it's important that you speak with a doctor if your bumps are causing discomfort. It's also recommended that you contact a doctor if you're concerned about any changes in your bumps or the overall condition of your skin. Many conditions can cause raised bumps to appear on the skin. Here's a list of 25 possible causes. Warning. Graphic images ahead. Skin disorders. Acne. Healthline/Getty Images. Commonly located on the face, neck, shoulders, chest, and upper back. Skin breakouts typically blackheads, whiteheads, pimples, or deep, painful cysts and nodules. May leave scars or darken the skin if untreated. Acne is the most common skin condition in the United States, according to the American Academy of Dermatology. It causes skin bumps that can range from very small and painless to large and painful. The bumps are usually accompanied by redness and swelling. Learn about the types of acne and how to treat them. Contact dermatitis. Tisperden/Shutterstock. Appears hours to days after contact with an allergen. Presents a visible rash with borders and appears where your skin touched the irritating substance. Itchy, red, scaly, or raw skin. Blisters that weep, ooze, or become crusty. Contact dermatitis is a condition that causes an itchy, red rash when your skin comes in contact with an allergen, like poison ivy, or irritant, like bleach. The rash may consist of raised, red bumps that ooze, drain, or crust. Learn about contact dermatitis treatments. Keratosis pilaris. Tiketlicorn/Shutterstock. Most often seen on the arms and legs but might also occur on the face, buttocks, or torso. Patches of skin that appear bumpy, slightly red, and feel rough. May get worse in dry weather. Keratosis pilaris is a common skin condition marked by an overgrowth of a protein called keratin. It causes small bumps around hair follicles on the body. The condition often clears up on its own by your mid-20s. Learn more about how keratosis pilaris may appear on darker skin. Growths. Bulla. Clement Bucholechit, CC BIOS A 3.0, via Wikimedia Commons. Clear, watery, fluid-filled blister that is greater than 1 cm, cm, in size. If clear liquid turns milky, there might be an infection. Bulli, plural of bulla, are raised, fluid-filled bumps that can result from friction or conditions like contact dermatitis and chickenpox. They usually go away within a week, but it's advised that you see a doctor if they become infected or need to be drained. Learn more about fluid-filled blisters. Cherry angioma. Rupendra Singh Rawat / Getty Images. Can be anywhere on the body but is most common on the torso, arms, legs, and shoulders. Small, bright red circular or oval spots that may be raised or smooth and bleed if rubbed or scratched. Generally harmless but may require removal if they're in problem areas. Cherry angiomas are common skin growths that can form on most areas of the body. They develop when blood vessels clump together, creating a raised, bright red bump under or on the skin. They appear with increasing age, often starting in your 20s or 30s. Trusted source. Corns and calluses. Vitalis 83/Shutterstock. Small circles of thickened skin with a painful, horn-like central area of hardened tissue. Commonly found on the tops and sides of the toes and on the soles of the feet. Corns or calluses are rough, thickened areas of skin caused by friction and pressure. They're most often found on the feet and hands. Learn how to get rid of corns at home. Cyst. Z99/Shutterstock. Slow-growing bump under the skin that has a smooth surface. Can be large or small and is usually painless. Typically not a problem unless it's infected, very large, or growing in a sensitive area. Some grow deep inside your body where you can't see or feel them. Cysts are growths that contain fluid, air, or other substances. They develop under your skin in any part of your body. They feel like a small ball, and you can usually move them around slightly. Discover how home remedies might help with cysts. Keloids. Harold Diaz Lara/Shutterstock. Symptoms occur at the site of a previous injury. Lumpy or rigid area of skin that may be painful or itchy. Area is flesh-colored, pink, or red. Keloids are smooth, raised growths that form around scars. They're most commonly found on the chest, shoulders, and cheeks. They're similar to hypertrophic scars but can grow to be much larger than the original wound. Learn how to help reduce the appearance of keloids. Lipoma. Casa Nyafana/Shutterstock. Soft to the touch and moves easily if prodded with your finger. Small, just under the skin, and pale or colorless. Commonly located in the neck, back, or shoulders. Only painful if it presses on a nerve. Lipomas are collections of fatty tissue under the skin and are often painless. They usually form on the neck, back, or shoulders. They're typically harmless, but you can remove them for cosmetic reasons or if they cause pain. Learn more about lipoma removal surgery. Nodule. Photo by DermNet New Zealand. Small to medium growth that may be filled with tissue, fluid, or both. Usually wider than a pimple and may look like a firm, smooth elevation under the skin. Usually harmless but may cause discomfort if it presses on other structures. May also be located deep inside the body where you can't see or feel them. Nodules result from abnormal tissue growth. They appear in common areas like the armpits, groin, and head and neck region. Seborrheic keratosis. Suteja, E. K. Ahmed, R. Suteja, E. Rawawi, R. Sawarsa, O. and Gunawan, H. 2021. A successful defect closure after total excision of seborrheic keratosis with atypical clinical presentation using island pedicle flap in an elderly patient. International Medical Case Reports Journal, 14, 157-161. Round, oval, dark-colored growth with a stuck-on appearance. Can be located anywhere on the body except for the palms of the hands and soles of the feet. Raised and bumpy with a waxy feel. May be skin-colored, brown, or black. Seborrheic keratosis, plural of keratosis, are common, harmless skin growths usually seen in older adults. They appear as round, rough spots on the surface of the skin. They can affect many areas of the body, including the chest, shoulders, and back. Learn how to tell the difference between seborrheic keratosis and melanoma. Skin tags. Skin growths that can become up to a ½ inch long. Same color as your skin or slightly darker. Most likely friction-related cause. Commonly found near the neck, armpits, breasts, groin, stomach, or eyelids. Skin tags are small, fleshy flaps of skin. They usually grow on the neck or in the armpits. They may be the same color as the skin or slightly darker. Review the differences between moles and skin tags. Strawberry nevus. GSTK, CC by SA 4.0, via Wikimedia Commons. Red or purplish raised mark, commonly located on the face, scalp, back, or chest. Appears at birth or in very young children. Gradually gets smaller or disappears as the child ages. Strawberry nevus is a red birthmark also known as a hemangioma. They are most common in young children and usually disappear by age 10 years. Infections. Certain bacterial and viral infections cause skin bumps. Some may go away on their own and may not require treatment. But some will only get worse if they go undiagnosed and untreated. Boils. Tagus prajapati/Shutterstock. Bacterial or fungal infection of a hair follicle or oil gland. Can appear anywhere on the body but are most common on the face, neck, armpit, and buttock. Red, painful, raised bump with a yellow or white center. May rupture and weep fluid. Boils, aka furuncles, are infected hair follicles that look like red, raised bumps on the skin. They can be painful but eventually go away once they burst and release fluid. Learn whether you should pop a boil on your own. Chickenpox. Mixmic/Getty Images. Clusters of itchy, red, fluid-filled blisters in various stages of healing all over the body. Accompanied by fever, body aches, sore throat, and loss of appetite. Remains contagious until all blisters have crusted over. Chickenpox is a common childhood virus characterized by red, itchy bumps that form all over the body. Adults can get it too, and symptoms are often more severe. Learn about the varicella vaccine to help protect yourself against chickenpox. Cold sore. Kuzenkova_Yulia/Getty Images. Red, painful, fluid-filled blister that appears near the mouth and lips. Affected area will often tingle or burn before the sore is visible. May be accompanied by mild, flu-like symptoms, such as low fever, body aches, and swollen lymph nodes. Cold sores result from activation of the herpes simplex virus. They appear as red, fluid-filled blisters around your mouth and other areas of your face. They're most contagious when they burst open but still contagious when they've scabbed over. Learn more about what can trigger the virus that causes cold sores. Impetigo. Z99/Shutterstock. Common in babies and children. Irritating rash and fluid-filled blisters that pop easily and form a honey-colored crust. Rash is often located in the area around the mouth, chin, and nose. Impetigo is a highly contagious bacterial skin infection common in young children. Adults with impetigo often contract the infection from skin-to-skin contact as part of contact sports trusted source. Discover natural home remedies for impetigo. Molluscum contagiosum. Mediscin/Alami stock photo. Bumps that may appear in a patch of up to 20. Small, shiny, and smooth. Flesh-colored, white, or pink. Firm and dome-shaped with a dent or dimple in the middle. Molluscum contagiosum is a typically harmless viral infection that can affect all parts of your body. These small, flesh-colored bumps can arise from skin-to-skin contact with someone with the infection. It's most common in children ages 2 to 5 years. Trusted source, but adults can get it too. Learn how molluscum contagiosum is passed on and how to prevent it. MRSA, staph, infection. Key West wedding photography, Kobo. This condition is a medical emergency. You may require urgent care. Skin infection that often looks like a spider bite, with a painful, raised, red bump that may drain pus. Needs to be treated with powerful antibiotics and can lead to more dangerous conditions like cellulitis or blood infection. An MRSA, staph, infection is triggered by a type of staphylococcus, or staph, bacteria resistant to many different antibiotics. These bacteria commonly live on the skin but can cause an infection when they enter through a cut or scrape. Learn what to expect as your staph infection heals. Scabies. Public domain, via Wikimedia Commons. Symptoms may take 4 to 6 weeks to appear. Extremely itchy rash that may be pimply, made up of tiny blisters, or scaly. Raised white or flesh-colored lines. Scabies is a skin infestation of a tiny mite called Sarcoptes scabii. It produces an itchy, pimple-like rash. Without treatment, they can live on your skin for up to 2 months. Trusted source. Discover home remedies for scabies. Wart. May be found on the skin or mucous membranes. May occur as one wart or in groups. May be skin-colored, pink, or slightly brown. Warts are raised, rough bumps caused by the human papillomavirus, HPV. They typically develop on the hands and feet, but it's important to see a doctor if they develop on your face or other sensitive areas. They're also contagious and can cause you to pass HPV to others. Discover home remedies for warts. Skin cancer. Skin cancer can cause other types of raised skin bumps. There are several types of skin cancer, all requiring medical management and treatment. Actinic keratosis. Jody Jacobson/Getty Images. Typically less than 2 centimeters, or about the size of a pencil eraser. Thick, scaly, or crusty skin patch that may itch or burn. Appears on parts of the body that receive a lot of sun exposure: hands, arms, face, scalp, and neck. Usually pink in color but can have a brown, tan, or gray base. Actinic keratosis is a precancerous skin condition usually due to sun exposure over a long time. It's more common in older adults and people with lighter-colored skin. Learn more about the differences between actinic and seborrheic keratosis. Basal cell carcinoma. Copyright 2011 Erica Varga et al. CC by 3.0. Raised, firm, and pale areas that may resemble a scar. Dome-like, shiny, and pearly areas that may have a sunken center, like a crater. May be pink, red, or discolored. Visible blood vessels on the growth. Easy bleeding or oozing wound that does not seem to heal or heals and then reappears. Basal cell carcinoma affects the cells in the lower layer of your epidermis. It produces painful bumps that bleed in the early stages. It's the most common trusted source form of skin cancer and has a very high survival rate. Learn more about Mohs surgery, a standard treatment for basal cell carcinoma. Squamous cell carcinoma. Reproduced with permission from copyright DermNetNZ, www.dermnetnz.org 2022. Often occurs in the face, ears, and back of the hands. Scaly, reddish patch of skin that progresses to a raised bump and continues to grow. Growth that bleeds easily and does not heal, or heals and then reappears. Squamous cell carcinoma begins in the squamous cells in the outermost layer of your skin. The condition causes scaly, red patches and raised sores to develop on the skin. These abnormal growths often form in areas exposed to ultraviolet, UV, radiation. Learn more about the different types of non-melanoma skin cancer. Melanoma. Nasocoma/Shutterstock. Mole anywhere on the body that has irregularly shaped edges, asymmetrical shape, and multiple colors. Mole that has changed color or gotten bigger over time. Usually larger than a pencil eraser. Melanoma is the least common but most serious form of skin cancer. It begins as an atypical mole. Cancerous moles are often asymmetrical, multicolored, and large, with irregular borders. They can appear anywhere on the body. View more pictures of melanoma. When to see a doctor about raised skin bumps. Most skin bumps are harmless and aren't cause for concern. However, it's important that you see a doctor if skin bumps change or worsen in appearance, or last for a long time. You are in pain, or they cause discomfort. You don't know the cause of the bumps. You suspect you have an infection or skin cancer. A doctor will perform a physical examination and inspect the skin bumps. Expect to answer questions about your bumps, medical history, and lifestyle habits. A doctor may also perform a skin biopsy to test if the skin bump is cancerous. This procedure involves taking a small sample of skin tissue from the affected area for analysis. Depending on the results, the doctor may refer you to a dermatologist or other specialist for further evaluation. Treatment for raised skin bumps. Removal. Treatment for raised skin bumps depends on the underlying cause. Most common causes of skin bumps are harmless, so you probably won't need treatment. However, if your skin bumps are bothering you, you might be able to have them removed for cosmetic reasons. For example, a dermatologist can remove skin tags or warts by freezing them off. They can also surgically remove certain skin bumps, including cysts and lipomas. You might be able to remove some itchy or irritating bumps with topical ointments and creams. If a doctor finds that your skin bumps are cancerous or precancerous, they will most likely remove the bumps completely. You will also need to attend regular follow-up appointments so your doctor can check the area and make sure the cancer does not come back. Medication. In cases where additional medical treatment is required, a doctor will prescribe medications that can help eliminate your skin bumps and the underlying cause. For a bacterial infection, such as MRSA, you may need antibiotics. For a viral infection, such as chickenpox, a doctor may recommend over-the-counter medications and home treatments. Some viral infections, such as herpes, cannot be cured. However, a doctor can give you medications to help ease symptoms. What to know about COVID-19 rash? Rashes and COVID-19. Appearance. Pictures. Causes. Rash after vaccine. Treatment. When to seek medical help. Takeaway. Some people with COVID-19 may develop a rash. The type of rash varies from person to person. Certain rash types may suggest a more severe infection. COVID-19 is the disease caused by the SARS-CoV-2 virus. While many people who become sick with COVID-19 experience a mild or moderate illness, some can develop serious symptoms that require hospitalization. The most common symptoms of COVID-19 are fatigue, fever, and cough. However, some people may experience less common symptoms such as rash. Below, we explore what COVID-19 rashes look like, how they can be treated, and when it's important to see a doctor. Are rashes a sign of COVID-19? Some people with COVID-19 may develop a rash. While skin symptoms have been reported in adults and children, most available research centers on adults. It's unclear how often people experience skin symptoms with COVID. Findings from studies range from 0.2% trusted source in a 2020 Chinese study to 60% trusted source in a 2021 European research review. Some researchers think there may be regional variations and that skin symptoms like rash are more common trusted source among people who live in North America and Europe. Some general symptoms associated with many COVID-19 rashes include skin discoloration. Rashes are typically discolored in comparison to neighboring skin. On light skin, a rash may look red, pink, or purple. On dark skin, it may appear purple, ashy gray, or dark brown. Swelling. The affected area may appear swollen or puffy compared to surrounding skin. Itching. Many, but not all, types of COVID-19 rash may itch. When do rashes appear and how long do they last? When exactly the rash occurs during COVID-19 can vary. In some instances, it may appear at COVID-19 symptom onset, while in others, it may happen several days after other symptoms have developed. According to the American Academy of Dermatology, COVID-19 rash can last 2 to 12 days. On average, most people have a rash for 8 days. However, rashes impacting the toes may last 10 to 14 days. What does a COVID-19 rash look like? The appearance of COVID-19 rashes can vary. While some infectious diseases, such as chickenpox and measles, cause a very distinctive rash, a rash due to COVID-19 can take many forms. Hives. COVID-19 rash can appear as itchy patches or wheals that resemble hives. These most often affect the limbs and torso. Macules and papules. In some cases, a COVID-19 rash can consist of itchy spots that may either be flat or raised, usually on the torso. Rash with blisters. This type of COVID-19 rash can appear with blisters that may look similar to chickenpox. It's most often observed on the torso and may itch. Lace-like pattern. Some COVID-19 rashes can have rings of skin discoloration that form a lace or net-like pattern, typically on the legs. Pinpoint spots. This type of COVID-19 rash consists of dark pinpoint spots, most often on the legs. Toe rash, also referred to as COVID toes. This type of rash causes discolored patches and swelling of one or more toes. The affected area may be painful, itchy, or have a burning sensation. Toe rashes appear to be more common trusted source in young adults. Some research suggests that the type of rash you experience may be related to the severity of your infection. In a 2022 systematic review trusted source, people with macules and papules tended to have a less severe course of COVID-19. People with a lace-like pattern or pinpoint spots tended to have more severe disease. Pictures of rashes associated with COVID-19. Below are some examples of what COVID-19 rash can look like. View all. A generalized, itchy rash may be seen in association with COVID-19. J. Velodras by order of Jmarchan, via Wikimedia Commons. What causes COVID-19 rash? Researchers don't understand why some people with COVID-19 get a rash and others do not. They also don't know what exactly causes the rash to occur. Some possible mechanisms include direct infection of skin tissues by SARS-CoV-2, immune system activity, the effects of increased blood clotting, hypercoagulability, that can sometimes happen in COVID-19. It's also possible that different types of COVID-19 rash will happen through different mechanisms. Researchers are working to find out more. Multisystem inflammatory syndrome in children, MISC. MISC is a potentially serious complication of COVID-19 in children that causes inflammation in various organs in the body. Doctors and scientists do not yet understand what causes MISC. Skin symptoms are associated with MISC and can include trusted source. Rash, redness of the hands, feet, or both. Lips that are dry, red, or cracked. Other potential symptoms can include red, bloodshot eyes, fever, extreme fatigue, abdominal pain, digestive symptoms like vomiting and diarrhea, neck pain. Many children who develop MISC will need to be cared for in a hospital. Because of this, it's important to contact your child's pediatrician immediately if your child has symptoms of MISC. Can you get a rash after you've been vaccinated? It's also possible to develop a rash after receiving your COVID-19 vaccine. Let's look at this in a little more detail. Allergic reaction. Some people may have an allergic reaction to the COVID-19 vaccine. If this happens, you may notice a rash or hives after you get your vaccine. Allergic reactions to the COVID-19 vaccine can be classified as either non-severe or severe. Non-severe allergic reactions happen within 4 hours of vaccination. They may include signs such as hives, swelling, and wheezing. Severe, this type of reaction is called anaphylaxis. It typically happens in the minutes after vaccination and can include hives, swelling of the face and throat, and dizziness or fainting. Seek immediate care if you have an allergic reaction to a vaccine. If you have an allergic reaction after getting your COVID-19 vaccine, the Centers for Disease Control and Prevention, CDC, trusted source recommends you seek emergency medical care. The CDC also recommends you do not receive further doses of that vaccine. You may be able to receive a different type of COVID-19 vaccine. You may wish to speak with a doctor for more guidance. Was this helpful? Delayed rash at the injection site. Some people may get a rash at the site of their injection. You may see this referred to as COVID arm. This type of rash is most often associated with the Moderna COVID-19 vaccine and typically happens after the first dose. However, it can also occur after a future dose. Delayed rashes at the injection site typically appear about a week after vaccination and last about 4 days. Trusted source. This rash can be large and include symptoms like redness, swelling, warmth, itching, pain. This type of reaction isn't harmful. If you have a delayed rash at the injection site, the CDC recommends trusted source you still receive any recommended additional doses or boosters. However, you may want to receive it in your other arm. What's the best way to treat a rash from COVID-19? Most rashes that happen with COVID-19 will go away in about a week. Meanwhile, you can help treat a COVID-19 rash at home by doing the following. Apply a cool compress to the affected area to help ease swelling. Indulge in an oatmeal bath to help soothe irritated skin. Use OTC topicals, such as hydrocortisone or calamine lotion, to help alleviate itching or swelling. Take OTC antihistamines to help reduce symptoms associated with hive-like COVID-19 rash. Avoid scratching to help reduce the risk of infection, scarring, or skin pigmentation changes. A doctor may also prescribe a prescription medication to help with a COVID-19 rash. These may include corticosteroids in a topical or oral formulation. When to see a doctor? If you develop an unexplained rash, it's a good rule of thumb to talk with a doctor. COVID-19 rashes may appear very similar to rashes caused by other medical conditions that need treatment. The only way to be sure if your rash is due to COVID-19 is to get a COVID-19 test. Whether or not it's due to COVID-19, it's important to seek medical attention for any rash that happens along with any of the following symptoms: fever, pain, blisters, signs of an infection, such as swelling, warmth, and pus drainage, covers a large area of your body, appears suddenly and begins to spread quickly. If your rash is due to COVID-19, seek immediate medical attention or call 911 if you develop any of the following serious symptoms: difficulty breathing, pain or pressure in your chest that does not go away, skin, lips, or nails that are blue or gray, trouble staying awake or difficulty waking up, confusion. COVID-19 symptoms usually show up in this order. Everything you need to know about keloid scars. Pictures. Symptoms. Causes. Versus hypertrophic scars. Home treatment. Non-surgical treatment. Surgery. Laser treatment. Prevention. Outlook. We include products we think are useful for our readers. If you buy through links on this page, we may earn a small commission. Here's our process. How we vet brands and products. Keloid scars form to protect injured skin, such as burns or acne scars. They may flatten over time, but some people may prefer to have them surgically removed. When skin is injured, fibrous tissue called scar tissue forms over the wound to repair and protect the injury. In some cases, extra scar tissue grows, forming smooth, hard growths called keloids. Keloids can be much larger than the original wound. They're most commonly found on the chest, shoulders, earlobes, and cheeks. However, keloids can affect any part of your body. Although keloids are not harmful to your health, they may create cosmetic concerns. Pictures. View all. A common cause of a keloid on the ear is ear piercing. Keloid symptoms. Keloids come from the overgrowth of scar tissue. Keloid scars tend to be larger than the original wound. They may take weeks or months to fully develop. The symptoms of a keloid can include a localized area that is flesh-colored, pink or red, a lumpy or ridged area of skin that's usually raised, an area that continues to grow larger with scar tissue over time, an itchy patch of skin. While keloid scars may be itchy, they're usually not harmful to your health. You may experience discomfort, tenderness, or irritation from your clothing or other forms of friction. Keloid scarring can form on large areas of your body, but this is generally rare. When it happens, the hardened, tight scar tissue may restrict your movement. Keloids are often more of a cosmetic concern than a health concern. You may feel self-conscious if a keloid is very large or in a highly visible location, such as on your earlobe or your face. Keloid causes. Most types of skin injury can contribute to keloid scarring, including acne scars, burns, chickenpox scars, ear piercing, scratches, surgical incision sites, vaccination sites. An estimated 10% of people experience keloid scarring. Men and women are equally likely to have keloid scars. People with darker skin tones are more prone to keloids. Keloids are more common in the following populations: people of Asian descent, people of Latin descent, pregnant people, people younger than age 30. Keloids tend to have a genetic component, which means you're more likely to have keloids if one or both of your parents have them. A 2015 study found that the gene ONC may play a role in determining who develops keloids and who doesn't. The researchers found that people who have the ONC gene may be more likely to develop keloid scars than those who don't have it. If you have known risk factors for developing keloids, you may want to avoid getting body piercings, unnecessary surgeries, and tattoos. Learn about options for getting rid of keloids and other scars that are common on the legs. Keloids versus hypertrophic scars. Keloids are sometimes confused with another more common type of scar, called hypertrophic scars. These are flat scars that can range in color from pink to brown. Hypertrophic scars are smaller than keloids. And, unlike keloids, they can go away on their own over time. Hypertrophic scars occur at similar rates. Trusted source among men and women and affect people of all racial groups. They're commonly caused by various forms of physical or chemical injuries, such as piercings or exposure to harsh fragrances. At first, hypertrophic scars can be itchy and painful, but the symptoms subside as the skin heals. Learn about all your hypertrophic scar treatment options. Home treatment for keloids. The decision to treat a keloid can be a tricky one. Keloid scarring is the result of your body's attempt to repair itself. After the keloid is removed, the scar tissue may grow back, sometimes larger than before. Before pursuing any medical procedures, you can consider at-home treatments. Moisturizing oils, which are available online, can help keep the tissue soft. These might help reduce the size of the scar without making it worse. These treatments require frequent and careful application to be effective and take at least 3 months to work. Learn about other home remedies for old scars. Non-surgical treatment for keloids. Initially, your doctor will probably recommend less invasive treatments, such as silicone pads, pressure dressings, or injections, especially if the keloid scar is fairly new. Corticosteroids combined with botulinum toxin type A injections into the keloid tissue have been found trusted source to be effective in shrinking keloids. Combining this treatment with injectable chemotherapy agents, particularly a combination of the steroid triamcinolone and the chemo drug 5-fluorouracil, has been shown to be even more effective trusted source than treatment with a corticosteroid alone. Keloid surgery. In the case of very large keloids or an older keloid scar, surgical removal may be recommended. The rate of return for keloid scarring after surgery can be high. However, the benefits of removing a large keloid may outweigh the risk of post-surgery scarring. Cryosurgery is perhaps the most effective type of surgery for keloids. Also called cryotherapy, the process works by essentially freezing away the keloid with liquid nitrogen. Your doctor may also recommend corticosteroid injections after surgery to reduce inflammation and lower the risk of the keloid returning. Laser treatment for keloids. For certain types of scars, including some keloids, your doctor may recommend laser treatment. This treatment resurfaces the keloid and surrounding skin with high beams of light in an effort to create a smoother, more toned appearance. However, there's a risk that laser treatment can make your keloids worse by causing increased scarring and redness. While these side effects are sometimes better than the original scar, you may still expect some form of scarring. Learn about laser treatment for other types of scarring, which has similar benefits and risks. Preventing keloids. Treatments for keloid scarring can be difficult and are not always effective. For this reason, it's important to try to prevent skin injuries that could lead to keloid scarring. Using pressure pads or silicone gel pads after an injury may also help prevent keloids. Sun exposure or tanning may discolor the scar tissue, making it slightly darker than your surrounding skin. This can make the keloid stand out more. If possible, keep the scar covered when you're in the sun to prevent discoloration. Find out more about sunscreen and other ways you can protect your skin.